All right, I think what we'll do is that we'll get started here. We're close to on time, and we'll take what comes from here. The message that I want to start off today with is that if we think about this weekend in the light of our board process of becoming eligible to be chiropractors, yesterday in my mind was a whole lot about the written portion, and today is going to be a lot about the practical part of things. And so it's my hope that today we're going to be able to work through a number of situations in which you guys find yourselves in the real world. Whether you are out there right now and you have current contacts, or you hope to be able to have contacts, and how that might play out. We're going to walk through a number of case studies today in which we hope to be able to engage you guys in some thought process and really some outcomes that are going to be real world situations. I have a litany of case studies that we're going to go through. I would encourage, as I mentioned yesterday, you guys to come forward with your guys' contacts or situations. I had a conversation with a couple people yesterday, which we'll incorporate today. As I mentioned yesterday as well, we're going to be inviting Dr. Jim Patterson back into our discussion. Jim is an individual who's been out there for the last 15, 20 years doing on-site care and working with employers, and so we're going to talk with him when he arrives about communication issues and really the dialogue that takes place with companies and how do we sustain long-term relationships and a lot of those things, which I think are really important, because the premise of what we should be, the goal of what we should be trying to achieve is really these long-term relationships. Each of you are in a community right now that has employers, and you would like to have a relationship with those employers. That is obviously a long-term situation, and so a lot of our focus today is going to be on that, and how can we do things right from the beginning, and then how can we maintain that throughout the process, and really develop a relationship with a company that is enduring through good times and bad, because we all know that that employers, much like our offices or the economy in general, is going to go through good times and bad times. I've had the ability to go through companies, to be associated with companies who are in high levels of hiring, right? And so when we're hiring a lot of employees and we have all this new influx of people, what is it that challenges our health and wellness? What is it that challenges our safety? What is it that challenges our work comp system? And then the other side of the fact that I've had the opportunity to deal with is the downside of that, right? What happens when we have to lay people off, and what happens when we go through those things, and how can we as a consultant to these local employers provide a service in both of those markets. And as you've heard me talk before, and I will again the rest of today, I think that we're positioned in a better place than just about anybody else out there, especially because we are the local provider in a local community. Is there any who in the room right now is in a community of less than, let's say, 5,000? How about less than 10,000? All right, who's in a community that's over 50,000? Right. The great thing is that in all of those communities, we have a primary network of companies that we can serve and that we can provide service to. We talked a lot in the second session of this series about our target market and our target audience, but in reality, we'll find out today that no matter if we're in a community that is 2,500 or 25,000 or 250,000, there are companies that we can serve in that market, and not only serve to a point that benefits us from a business standpoint, but that benefits our community as well. And so we hope to be able to share some of those things with you here today. I'll say that my contact information is available here. My phone has has rung a few times with a few of you, and we've had some conversations about some things. But at any time in the future, know that one of the missions of the Sweary Center is really to provide services to you. That's where this 36-hour program has developed from, is the opportunity to provide a service to the DC in practice as to how we can integrate into not only occupational health, but really on-site care. And how is it that we can work with employers in your communities, and how can the Sweary Center assist in that? You know, not long ago, I was in your situation, right, where I was the local practitioner providing services to a company. And the one thing that always held me back in that situation is I didn't feel like I had enough resources to do everything I wanted to do by myself. And the great thing about the Sweary Center is that we're trying to create a situation where we can provide those additional services. And whether that's an ART provider reaching out to their local community, or whether that's a chiropractor in Brainerd that is looking to work with a local manufacturing facility, or whether it's somebody that just wants to promote chiropractic in their community, we feel that the Sweary Center has a unique opportunity to really assist you in that process. And so later on in today's message, we're going to talk about how the Sweary Center can help you along and or provide assistance to you in whatever goals it is that you want to achieve. I assume that if we're 20 people in the room and more online, that we all have different goals, right? Who in the room right now wants to provide on-site care at a local employer? A lot of people, right? Who wants to just have a relationship with a local employer? Right? A few of us. I think that's a really exciting thing, is that if we develop these relationships, then we have options, right? In chiropractic, I think what's happening is that our options are getting smaller due to forces within the healthcare arena, right? Whether it's managed care or whatever it else, or whatever that entails. I think that unfortunately, as a profession, we see the market collapsing a little bit, right? I think that the idea of occupational health, providing services on site, working directly with employers, affords us a whole new landscape to be able to say, hey, you know what, the services that we provide, right, they make a difference in people's lives, and that makes a difference within your company, and that's a profitable thing for the employer, for the employee, and for us as a healthcare profession. As Joe went through, at the end of his presentation yesterday, if we just do a little bit better job of communicating, of providing care in all of these situations, I believe that the market will come around to us. I believe that there's no better time right now. There's no better time than right now for the services that we have, especially to employers. So we'll go through and we'll talk a little bit about that. I wanted to start off this morning revisiting this graph, and you'll remember this graph from our last, from session 2, and that is that every employee that you come in contact with, and let's just take out the word employee, every person, right, us as individuals, right, we're somewhere along on this graph. When we met back in November, we were at some place on this graph, and maybe we've gone the right direction, or maybe we've gone the wrong direction in relationship to that. But the employees that you see, the patients that you see in your practice, are all going to be on this dynamic curve here for us, right? It's going to change over time. And where we're at, and I think one of the most valuable things that we can do as a healthcare provider is to educate the employee or our patients where they are on this graph. And if we can do that, then we can encourage them, we can motivate them to making some differences in their lives. Too oftentimes, the message that is given to our patients is that you are either diseased or you are healthy, right? Where's your lab test? Are you within the normal or are you outside of the normal? Right? That's what they understand, right? That's how the world works. And I believe that that's a dangerous message to give to to these employees or to our patients. And so I think we need to talk to our patients on this health continuum. And more importantly, in our work with working with employers, one of the things that we need to talk to employers about is that this is our vision. This is how we see it, right? This is how we take a look at the people that are working within their environment, is that nobody's either healthy or diseased. They're on some sort of health or disease scale. And the reason that that's important is that that makes sense to a lot of companies. That makes sense to the people who are making a decision as far as whether they're going to hire you for your consulting services, for your on-site care, and or for your continued long-term relationship. If we value the employee as far as healthy or non-healthy, right, that's a very dangerous thing for both the employer and the employee. We don't want to get in a situation where we're calling an employee healthy or unhealthy. We want to talk about this scale because the person that's in the danger zone here, the person that's in the middle of this process is probably most of the people out there. Would we agree with that? I mean, of the people that walk into your office, I'm guessing most of them are in the disease care. But if we can have the best practice, right? When one of the things that I enjoyed about what I did on site is that I had the opportunity to not deal with this section, right? We got to a point in many of our cases where maybe 5 or 10% of the people that I saw were in this diseased care. But I saw a whole lot of people that are in that danger care, right? I mean, if we were to redo that graph, that danger care should probably be significantly bigger. Because that's where most people lie. That's where most people are at. Whether it's due to lifestyle issues or whether it's due to previous trauma or genetics or all of these other things, those are the types of people that we can have the biggest impact on. And when we talk about having the biggest impact as far as employee health or our patients' health, that turns into company profits. And when we're talking about developing relationships with employers, that's where it changes. And that's one of the things that we're going to talk about today. We need to talk differently to patients than we do to employers, right? The employer, the companies that are out there, that are in our community, they want the best for their employees. I really believe that. There are very few companies that, that don't care about their employees. They understand that. They care more about profits than their employees, because if they can't make a profit, then they can't stay in business. How we can come into that picture is that we can do both, I believe. I believe that we have the opportunity to improve the health and well-being of that employee as well as the profitability of that company. And so when we sit down in a boardroom, when we sit down and whether we're talking the local dental office, right, where we're talking to a group of 15 people and discussing this, or whether we're walking down Penn Avenue and into the doors of Best Buy where there's 5,000 employees, right? This is the same message that we should bring to all of those companies, is that we can improve the health and well-being. And if we can take 80% of the people and make a 10% difference, we would have an enormous cost savings for each of those companies. That's the power that we have. And I think the exciting thing is that, as Joe described yesterday and we've talked about in previous sessions, is that the far majority of conditions that are out there for employees, the neuromusculoskeletal type of situation, is right in our wheelhouse. That's exactly where our strength lies. Should it stay to that, we'll review that further. But certainly we can have a dramatic impact on the health and well-being, and if we can just raise the health of the individual, let's say 10%, right? Let's not talk ridiculous numbers, right? I mean, I think we can do it 20 or 30 or 40 or 50%. And the really good people in this room, the really, really go-getters, the really people that connect, right? Not because of your health knowledge, but because of your ability to communicate. That's where the biggest impacts are going to be made. And we'll again review that in some case studies here as well. Again, getting back to some of the things that we covered last time, and I feel it's important to kind of review this, right? So what's going to happen today is that we're going to go through a number of case studies. I think that everybody should have a separate sheet in front of them that's got our SWIRI Center assessment on one side and then our strategic model on the other side as far as how we go about doing business. This isn't just how the Sweary Center goes about conducting their business. This is how consultants go about their business, right? This is how businesses function. And so I've given you kind of our sheet as far as how this works. And this is a sheet that we walk into employers, right? One of the things that's in our packet of information when we meet with an employer is that we walk in and we say, here it is. This is the process that we go through. You know, we go through the same process no matter if it's 50 employees, 500 employees, or 5,000 employees. What we do is this, right? So we go through an assessment, right, to be able to strategically plan, to talk to you about the potential improvements that can be made. Then what we're going to do is that we're going to implement that plan, and then we're going to follow up and we're going to show you the results on the end. And whether you're a company of, as I said, 50 or 5,000, this is the process that we take place. And one of the messages that we want to share with you in this series is to have this exact same process. Who in here has done a healthcare talk at a company? Handful of people, right? When you did that healthcare talk, describe to me how that came about. They called you up, or you called them up. What happened? They called you up. It happens a lot, happening more and more all the time, right? They called you up and said, hey, we'd like you to come in and what? Was it over lunchtime? How did it work?
It was over lunchtime. It went past lunchtime.
Okay. How about anybody else? Anybody else have a different experience? Did anybody else call up the company? How did it happen for you?
No, usually after safety.
Yep. Right? So that's the other thing, right, that happens, right? A lot of these companies have safety committees. They've got safety, or now they're switching, right? The landscape is switching. So it used to be safety. Now most of those safety committees are transferring into some sort of wellness committee where safety is an aspect of it, right? So these are the types of committees that call you in to do a healthcare talk. When you do your healthcare talk, how did you decide what you were going to talk on?
It's all about three parts. Basically, spine first, and then into the DOT physical and realm of what they need to do to be ready for their physical, what they need for their physical. Get into the details because that breaks them up and really gets them tied in.
So right, we talk about what's important to us, and where our foundation is in the spine, and then the DOT, and those types of things. Why did you decide to talk about those things?
Because that seems to tie them into you as a professional with knowledge, because that's all we have is our service and our knowledge.
Right. So the company's asking us to come in, and they're asking us to talk about a certain specific topic that's within our comfort zone, right? That's their perception, right? How about your experience, Doctor?
Actually, it was a small company, and it was, I guess I could say that, kind of a combined safety meeting, except for all the employees all kind of were there. And so I talked about kind of back school lifting.
Sure. So everything from lifting, all these things that are in our wheelhouse again, right? I've had two experiences in providing healthcare talks. One of them is that companies, you know, and really this is where my process started within occupational health, as a company came to me and said, hey, can you come in and talk to these employees about this issue, right? The other thing that happens is that as that progressed, and I wanted to do this further, and what you may want to do is that you might want to reach out to employers, and you might want to talk to their employees as an introductory to some of your services. One of the things that's really important to consider, no matter whether we're doing a healthcare talk, whether we're going in to do an ergonomic evaluation, or whether we're going to go and propose an on-site care clinic within their environment, right? One of the really important things to consider is, what do I do in my assessment to make sure that the information that I'm giving, I'm qualified to give, first of all, and second of all, is going to be beneficial both to the employee and the employer. So I want you to consider, in whatever services that you're going to choose to go out and promote or be a part of in your community, is that you do exactly that. You make sure that it's something within your expertise, that it's going to benefit the employees, and it's going to benefit the company. In session 2, I talked a lot about this win-win-win situation, right? Where we're going to create this situation where the company's benefiting, where the employees are benefiting. And that starts in the assessment phase. I believe that one of the only things that you can do to ensure that that's taking place is to do some sort of assessment. If it's a healthcare talk, maybe it's just questioning the HR person that's inviting you in or that you have communication with and saying, hey, well, what are your biggest issues? Is it the fact that we need to help out with some lifting instruction, right, in this case? Or maybe it's the fact that they need DOT examinations, and how do we do that, and how do we go about that, and how do we communicate to the employees why we're doing this and kind of the results of that. Or maybe it's something a lot deeper, right? When we're talking about an on-site healthcare situation, if you're going to go in and you're going to provide on-site healthcare, you're going to want you're going to want to know a whole lot more about what's going on at that company than if you're going to go in and talk about lifting, right? If I'm going to go in and talk about proper lifting mechanics, and I'm going to give them an injury prevention program where we're going to teach them how to lift, right? We're going to teach them physically how to lift. Well, then I need to know, what is it that they lift? How much do they lift? What are the job descriptions, like we talked about yesterday? What are the expectations of the employees? And not only what are the expectations of the employees, but in the assessment phase, you want to find out what the expectations are on the floor. Because in my experience, job descriptions are written by an individual in an office, and what really happens out on the floor is something dramatically different. And so when Joe was going through and talking about the BSI yesterday, and he talked about going out to the company and really physically seeing what takes place, I don't think there's any replacement for that. I think that if you're getting a job description in your office that's written by somebody else in an office, what happens on the floor is probably dramatically different to that. We'll walk through some case studies about that here today too. But the assessment phase in this process is extremely important. I believe that we need to get the input of management, of the employees. We need to take a look at the cold, hard facts, the data that's involved, and then we need to take a look at the facility there as well. And so when we're doing that assessment, really take into account all of those aspects on whatever level. And sometimes the investigation or the depth to which you look into each of those things depends upon your services. As I said, if a company calls you up and says, hey, I'd like you to come give me a back care class, which is what they oftentimes call it, you know, don't say no. Don't say, well, I've got to go through this 18-step process to do that. No. Find out the pertinent information to be able to provide that service, but then engage them in the conversation that, hey, you know what, there are other services that we have, and with a little bit more investigation, I think we can provide you some, some reasonable options as far as additional services. So use that opportunity to share with them that you have a process to go through. After the assessment phase, we think it's really important to gather that data. And one of the most important things about the strategic planning aspect of what we do is setting those outcome goals and tracking measures. So if we're doing on-site services, right, and we've done a fair job of assessing what's going on, and now we're going to do some strategic planning. So now we've gotten the idea that we need to do a back care class. They want to have that. Well, what should be the outcome measures of that back care class? So if it's a service as simple as providing health information to employees, or if it's as in-depth as an entire on-site treating facility, I think that having some outcome measures is extremely important for developing a long-term relationship. What I mean by that is this, is that if we're going to do a back care class, what are some of the outcome goals and training methods that we should be considering in our strategic planning? Anybody have any idea? What type of outcomes are we looking for in a back care class? So we actually have an employee that is able to utilize the services that, or the education that we're giving them, right? It's taking education and turning that into an action, right? So that's certainly an outcome that we would hope to be able to have. So one of the things that we want to be able to do is after our back care class, we want to be able to come in and we want to be able to watch employees and see them use the techniques that we described, right? Whether it's whether it's that wide stance, toes out, right? Keep everything close to us, right? I mean, if we've got visual evidence of that taking place after we've given our back care class, that's a good thing, right? That's an outcome measure that's successful. How about if we're doing an on-site clinic, right? So we're actually on-site treating employees, workplace injuries, non-workplace injuries, the whole gamut. What outcome measures do we want at that point? Is it going to be different than the back care class? Fewer injuries. What else? Fewer reported injuries, right? The level of our service is going to dictate the outcomes that we need to be able to measure, right? If I come in and give a back care class, one of the things, I really have two goals in an educational situation like that. Number one, that we have high utilization as far as the information. So I want as many people in the room as possible, right? So that's one of the things that I'm going to put on the company. I'm going to say, well, okay, what do I need to do to have everybody in the room? And that includes production level, middle management, senior management. I want the president of the company to be sitting right there while I'm giving the back care class, right? Right? He might not lift anything, but I want him in this class. So if I'm giving a back care class, I want high utilization of the information. So everybody's getting the information. And then I want transformation into action, right? So then I want to be able to decide how is it that I know that the work is being done out there. And if you do that in a back care class, if you say, okay, I'll come in and give your back care class, right? We'll talk about lifting, but for me to be able to do that, I need two things. I need to make sure that we're as close to 100% of the employees at this facility that get this information. And then what I want to do is that I want to be able to come back through 2 weeks later, and I want to be able to walk through the facility to see who's implementing this. That's going to be a very, very powerful message to that employer. You're not just there to give information, you're there to make a change. And that's what I think that we need to do. That's the difference. That's what's going to separate us from every other health and safety expert out there. There is no shortage of people who want to give a back class, right? There is no shortage of people that have great information. What there's a dramatic shortage of is people who want to be accountable for that action, right? So we want to be able to follow up that back care class with a 30-minute over a lunch hour in the morning before you start your day to be able to go on site and say, okay, who is really doing this? So that we can give some feedback to the company that says, man, we missed our mark, we made our mark, whatever the case might be. And we can't be afraid to fail in that mark, right? We just need to be able to know where we're at so that we can make some improvements on that. If what we're doing is implementing an on-site care facility, well, obviously things change pretty dramatically at that point. What are some of the things that we would hope to be able to see in addition to cost savings or injury reduction with an on-site clinic? So you're providing care on-site, right? We've done some baseline measurements that tell us this is how many people are being injured. And most companies will come to you because of injury rates, right? We know that. There are more and more companies right now that will come to you because they want to make some improvements on their health care, and we'll talk about that a little bit later here too. But if what they're doing is they're coming to us and saying, okay, we want to provide this on-site clinic because we want to reduce injury rates, what are some of the other things that you should communicate to them would show or validate your services and your costs there? Anybody have any ideas? Absenteeism. Very, very, very good. Right? Presenteeism. We've talked about that. Right? That's good to hear. Anybody else? What are some of the other things? How about utilization? Right? If we have an on-site clinic and we're seeing 10% of the employees, is that a successful program? If we're having success with 10% of the employees, you want to know what the company's going to come back to you and say? Those 10% were going to go out and get their own care anyways. And companies are sophisticated enough to understand that, right? Because they're going to see that from the number side of things. So if you're seeing 10% of the employees that are on site there, well, those 10% were probably going to come into your office anyways. Maybe they're just coming to you on site because it's a little bit more convenient. I think one of the biggest things that you can do with an on-site clinic or treating people on site is to drive utilization. So, right? So what we're doing is that we're making sure that a high volume of employees come through your program. Does that scare a lot of employers at first? It scares some that don't understand the bigger picture, right? One of the things that they want to do is that they want to drive down costs. They want to drive down utilization in many cases. There's some education that needs to be done there where we need to talk with employers about the more people that we see in our on-site programs, the bigger impact that we can have. And so if you can pay me a reasonable fee to see these people, we're going to see overall healthcare costs coming down, whether that be through the work comp system or through the general health care. So I think utilization should be a huge thing that we're coming back and we're taking a look at for our outcome measures. Additional outcome measures, like we talked about, oftentimes are going to be generated directly by the company, right? So one of the things that we need to do in the assessment phase is ask management what it is that they want to see. Because some of them are going to say absenteeism, some of them are going to say presenteeism, some of them are going to say, I just need my work comp reduced by $300,000, right? And so oftentimes asking that question will be the key indicator as to, in the strategic planning phase of what we're doing, is where the direction we're headed. We want to be able to meet the expectations of management in the strategic planning phase, right? So we want to be able to come back to them. There are some things that down the road we might be able to integrate in that we think are important. You know, we might say, you know, well, what we'd really like to be able to do is affect people's overall health habits, whether that be smoking or weight management or any of those types of things. But maybe the company's, their primary focus is work comp. Well, that better be your outcome measure that you're proposing in your strategic planning so that we can get that program approval, right? So that the company says, all right, here's the deal. It's been my experience that most companies who are engaged in this part of the process, right, where they're considering your options and all these types of things, is that they're willing to give you some test period. And so talk to them about that. I have never been, and maybe this is a reflection upon me or the market, I'm not sure, but I've never been able to convince a company to go with a 5-year plan with my services, right? They want to know what's going to happen in the next year. And sometimes what happens is that companies want to know what's going to happen in the next quarter, which is really scary. And if that's their concern, if their concern is, can we make some improvements in the next 3 months, that discussion needs to be needs further conversation. And again, we'll kind of go through how we handle some of those things in our case studies, because it's unrealistic that we're going to affect big issues in short term. Last time in session 2, we talked about short-term goals and long-term goals. And again, I want to reiterate the fact that our short-term goals really are to drive utilization, and our long-term goals are to drive cost savings, profits, and employee health and well-being. Those are really important messages to bring to the company and to give them a proper expectation as to what to expect. And I want you guys to keep this sheet close, right? Because when we go through our case studies later on, we're going to walk through this process, and I want to engage you guys in the thought process of taking it from that assessment all the way through to the outcomes and the evaluation of things. On the back side of the sheet that you have there is, again, the Sweary Center's process for the assessment phase. We feel that this is the one thing that separates us from just about everybody else in the marketplace. I can tell you that the university, Northwestern, has been approached by an on-site provider, right? And they want to, their healthcare system, and they want to provide an on-site clinic within Northwestern, which is just amazing to me. We have a clinic system here already, right? Why aren't we utilizing that? That's for a different discussion. But this healthcare group wants to put an on-site clinic here for the employees at Northwestern to be able to utilize. Okay. What assessment did they go through to propose this to the university, do you think? Anybody have ideas what they might have done? They took a look at how much the university spends on healthcare. That was the single factor that they looked at. They didn't ask us what we wanted. They didn't ask us what services we already had. They didn't ask us why our employees don't utilize the clinic system the way they should. They didn't ask us how we tried to motivate employees into the clinic system that we currently have. What they did is they took a look at the expenditure that we had in healthcare, and they said, you guys could benefit from an on-site clinic, and we can save you this amount of dollars. And their proposal for an on-site clinic was in the hundreds of thousands of dollars, right? So the university would spend additional hundreds of thousands of dollars to provide an on-site clinic, of which we already have. How good is that assessment, right? As a management of the university, how would you receive that, right? As a management, as an owner of a local practice, and somebody came in and said, that's craziness, right? The sad fact is that their proposal could save the university some money in administration costs, right? So for $300,000-$400,000, we can do this, and we can save some administration costs, and we can save some money. And that's what every other on-site major medical clinic is doing out there. They're trying to save administration costs, right? Whether it's the major health groups or the major hospital groups or the major health providers, their idea of providing care on site is that they're going to save administration cost. Right? They don't have to have the brick and mortar. They can put somebody on site. We can manage claims a lot more efficiently. Right? We can hopefully get 10% or 15 or 20% maybe in really good cases of people to come into that on-site clinic and be ahead of this game. I think that is like, it's like the iceberg, right? It's the part we see above the water, right? The big part that really is the cost savings is what can we do to manage and motivate employees, right, who wouldn't take advantage of that. It isn't the administration costs, it's the fact that we're just not very healthy as a society, right? We're a healthcare institution right here. We're the employees of Northwestern educate students, whatever their role is, on better health and wellness. But yet we're still not willing to take care of ourselves and be health-minded to the level that we should. What? So good question. So good question. Where the question is that, so all these other major medical providers in the on-site arena are looking at administrative cost savings, right? So how does that happen? So where it takes place is in the transaction aspect of care. So if we provide an on-site clinic here, let's say, and a big model out there right now is to take a minute clinic type of situation and put that within an employer. That's your competition out there for on-site care, right? Is that we're going to take a minute clinic and we're going to put it on site, and what we're going to do is that we're going to put a nurse practitioner or a physician's assistant on site to be able to manage the cases that they don't want to see within their clinic system already. So what they want to do is that they want to take care of everything from common colds, infections, these types of things, right? They want to be able to manage those things and they can do that much more efficiently if they can see 200 people a month without having the receptionist, the scheduling person, all of these other administrative people involved. If all I have to do is I've got to walk into the office here at Northwestern and I can see the nurse practitioner, there's no front desk person, right? There's the marketing for my services has already been paid for by Northwestern because we're expected to promote the internal process. So what it's doing is it's just taking away those administrative costs and getting the patient in the door. Does that make sense? Well, so what happens is that the the university would pay for this on-site clinic. Okay? Or let's just take the university away. You know, manufacturing company XYZ pays for this, pays $200,000, $300,000 for this on-site clinic, right? Well, and what happens is that all of those claims then don't go through their traditional medical insurance, right? So the healthcare systems out there, Health Partners, United Health Group, whoever you want to pick, right? They look at it and say, okay, well, we could take the top 15% of visits away from their healthcare system, and we're both going to make money or save money if we see them on site with just one little provider, and then they're going to go out and they're going to hire, and by the way, they're going to hire a physician's assistant to come on site here, or a nurse practitioner for about $105,000 or $110,000 a year, and that's going to save us money because they don't have to have that person going out to a different clinic, and they don't have to manage the cases there. The university saves money because it's an in-house program. They pay one fee for all of that, and the more they can drive services into that, the less services they have outside. Are we following?
But the only services, what do they, if their secretary walks into a clinic outside, how is that a cost to national?
Well, what happens is that if you see an off-site clinic, right? So an off-site clinic, it goes through the third-party benefits package, right? So it goes through your insurance, which means you got to have somebody that processes the claim, which means that you got to have somebody that pays the claim, which means that you have to have somebody that oversees that claim to make sure that the doctor's notes were fine and all. That all goes away in an on-site program, right? With an on-site program, the university pays one fee to them, right? And we don't have all of that oversight. What the university is saying, or what a company is saying when they hire you to come on site, is that we trust you to take care of everything, and we're going to get rid of the third-party oversight process, because that's the part that's going to cost us money, and we're going to invest in you because we believe in you, right? And our oversight in that process is going to be what we get the feedback from our patients. So again, that's one of the things that we're going to get into with the case studies, is that when you're on site, what you're doing, you know, for our on-site situations, we're asking the company to pay us directly. So they're going to pay us $4,000 a month to be on site for 8 hours a week, and that's the contract. At the end of the day, we're going to have some outcome measures that's going to show them that not only are their employees satisfied with what's going on, not only are we having good outcomes with their employees, but that we've saved them money, and that's why they're going to that's why they're going to renew the contract with us.
You're transferring their variable cost to a fixed cost.
Yeah, right. I mean, so another point is that we're moving to a fixed cost system in the care, so they know exactly what it's going to be, and there's some relief in that. The bigger relief comes in the fact that at the end of the day, I can evaluate what you're doing, right? Because when I go out and buy an insurance policy, then I've got to rely on the insurance company to make sure that insurance companies make money on volume of claims, right? Most insurance companies will take your money, put it in a bank account, and then charge you for the claims that are being done. So they're making money on that interest in that bank account from your premium, and they're making money on the transactions. So what an on-site clinic does is that it eliminates that transaction fee that takes place. That's why the insurance company, you know, whether you're self-insured or whether you're fully insured, makes a big difference in how we're presenting these programs. And this will become a little bit more clear as we work through the day and we get these cases. More questions on that? We'll get to it as we go. The idea is that when we're doing the needs assessment, and especially if we're doing things for whether it's an ergonomic project or whether it's an injury prevention project or whether it's something that we want to do for an on-site clinic, really take a look at all aspects of what's taking place within the company. Take a look at the employees that are out there working and what their mindset is and where their health is. Take a look at management's perception and what it is that they want to achieve. Take a look at the hard facts, right? The documentation that's out there, the OSHA 300 logs that we're going to go through, the loss run reports that tell us exactly what the cost of healthcare is for them, right? Take a look at the facility. Are there improvements within the facility that can be made to address a lot of these things? As I said, a far percentage of the companies that approach you are going to have some sort of work comp issue. And if we can improve the ergonomics aspect of what's being done within that facility, that's going to eliminate things right up front for us, right? That's going to take care of the future problems. I will tell you that that ergonomic improvements do not take care of existing problems. That's one of the misnomers that's out there within the corporate world, is that oftentimes companies will hire somebody to come in to improve the ergonomics of what's going on, and that will take care of what's going to take place into the future. Unfortunately, the situation that's been at that facility has created a number of problems for those employees already. Whether those are clinical problems at this point, meaning whether they're already work comp cases, and there's a certain percentage that is, or whether there's a very big number of employees who have potential problems because they've lifted that 80-pound sack of feed, for the last 30 years, right? Well, now we're going to change ergonomics, and now it's going to be improved. No, we still have that same employee, and that, when we make some ergonomic improvements, we don't get rid of all the employees and bring in all kinds of healthy people. And so make sure that you help them understand that if we're going to make some ergonomic improvements, the other thing that we should be doing is that we should be looking at the health and well-being of the employees that are currently there or who have worked in those subpar situations for a long time. And we're going to talk a lot about the communication of that, because the language that we use with senior management, middle management, and employees is going to make a dramatic impact on the success of your program. One of the big mistakes that I made early on is in my communication and having the ability to understand who our audience is and how we talk to senior management as opposed to employees. And so we'll go through some of those things here as well. The other thing that I want to start off the morning talking about is that one of the most important things that you can do in your consulting field as a local practitioner, as somebody who's reaching out to business, as somebody who's doing on-site care, is that we never want to overpromise and underdeliver. It is a fatal mistake that you can never get back, right? Don't ever set the expectations too high. When we go into companies, when I talk to companies and I talk to them, I get really excited when I deal with companies who've got a lot of big problems, right? If I got a company that has a lot of problems, what can I do? There's a lot of room for me to help. And internally, my personality wants to say, I can do this and I can do that and I can take care of this, and that's a very dangerous situation to get into. When we talk about setting expectations on the company, we want to let it fall to our process, right? We want to say, okay, well, I think there's reasonable expectation for us to go through and to do an evaluation. Let's assess what's going on. Let the assessment play out what your expectations should be. What I mean by that is that if you walk into a company that has a company of 250 that's spending $400,000 a year on work comp, man, that on its surface is a really, really good thing for us, right? I mean, that's a company who needs our services, who we can sell our services to, who we think we can have a really big impact, right? But before we go in there and say, I can help you, I can do this, right? I can take care of that. Tell them, I want to go through an assessment process so I can show you how I can take care of this. Because that assessment process is going to set the expectation of where you're going to be down the line. And that's really, really important to do, because you might find out that those $400,000 of work comp claims came from one off-site accident that took place while the delivery truck driver was hit by somebody who ran a red light, right? So be careful about what the expectations that you're setting with the company. A company will always respect you more. I mean, every company has health and safety people walking in their doors saying, I can save you money, I can prevent this, I can do that with my latest and greatest idea. Companies are very receptive to you saying, you know what, let's engage in a conversation to let me see if I can help you. It's no different than if we're treating our chiropractic patients, right? Patient, you know, if we walk into somebody at the local restaurant in town and they know you're a chiropractor, I mean, well, I can help you, come on down, right? Or you say, come on down, let's go through an examination, let's see what I can do to help you. That's the difference. That's the approach that we need to provide to companies so that we can set a reasonable expectation as far as the outcomes that we can do, because it's always better at the end of the process to be able to say, you want to know what? I thought I could save you $200,000, right? Unfortunately, what happened is we saved you $300,000. You know, that's a much better situation to be in. Or whether it's $20,000 to $30,000, or whether it's, I thought we could get, 60% of the people involved in this program, but we really got 70% of the people. But you don't know that until you do an accurate assessment of what's going on. And so we want to encourage you, again, to do that. I'm going to take a break. It's close to the top of the hour, so we're 5:02 or about there. We'll start about 5 after, and then we'll start working through, again, some of the communication things that I think are important, and then getting involved in the case studies. I'll remind you that Dr. Patterson is going to be joining us this morning here as well. And when he arrives, we're going to sit down and have kind of an informal conversation as to how he's addressed some of these issues, how he's taken on some of these projects. And if you've got questions directly related to real-life situation, those will be a great time for us to go through that. So we'll see you in 10 minutes. A couple things that I just kind of want to recap from that first hour that led to some discussion in between the break here is that the idea of the administrative costs being reduced has a significant impact, or one of the things that you need to understand is whether a company is fully insured or self-insured. Is everybody in the room familiar with what that means? So that's a pretty important concept for you to understand going out into your community. Maybe what I'll do is just walk through it again. So a fully insured company goes out and buys a healthcare policy for their employees. So they pay a premium. No matter what happens with the claims, they pay a premium. And the premium they pay oftentimes is directly related to their past history, right? So if they've had so many dollars of claims over the last 3 years, their premium is set. If I'm a self-insured company, one of the things that happens is that it's my money, and I set aside a pool of money to be able to use for health care. And then I hire a third-party administrator, oftentimes those same companies, to just administer the paying of those claims. So if we're dealing with a self-insured company who has its own money on the general health care, the work comp, or whatever, right? It's their money. They're going to be a better candidate for us to talk to because we can save a broader portion. If we're dealing with a company that's fully insured, who is buying an insurance premium, we need to understand that us driving down their healthcare expense probably is going to be a year or 2 or 3 away from changing their premium. Does that make sense?
Within that fully insured company, or the self-insured company, does their cost of administrating those claims, would they be charged more if they had a higher history?
Yes, right. So how the insurance industry works is that insurance companies make more money off of fully insured situations, right? Because they can say they can charge a premium that incorporates all of their administration costs and all of these types of things, and they can build in better margin into that. The margins for an insurance company on a fully funded company where they're just taking care of the transactions is often transaction-based, and that's a very competitive market, right? So they might get paid $8 or $7 or $6 or $3 or $2 for every transaction that's made. Whereas a fully insured company says, we're going to take the risk of, you know what, you're going to give us $1 million in premium this year. But because of that, we're going to build a bigger margin in to what we think you're going to spend, because if you end up spending $1.2 million, that's our loss. Does that make sense? So, and what's happening in today's marketplace, in this ever-changing world of insurance and healthcare and all of those types of things, is that there are a lot of companies that are doing one of two things. Either they're going partially self-funded, meaning they're buying a policy where everything over $1 million will get taken care of it in a fully funded program. But as an individual company, they're going to take care of all the expenses up to $1 million, right? So it's kind of like us, right? You know, my package through the university right here, right, is that I've got a $2,500 deductible or whatever it is for my family. I pay the first $2,500, and then the university's insurance kicks in after that. Companies are doing that same thing, where they're paying for, they're buying policies that where they pay for a portion of it to a certain ceiling, and then after that ceiling, then it's the insurance companies, and so they're a hybrid of that system, is I guess what I'm trying to say. The other thing that's happening is that companies who are smaller, right, the 2, 3, 400 employee companies or certainly based upon their industry, are coming together and doing co-ops, right? So it might be 4 companies that come together that form their own self-insured group, right? So that they share the risk amongst those 4 companies, and it becomes a little bit more affordable for the company that you know, has fewer employees, so that you don't get hit with one employee that might use up, you know, a vast majority of your resources or those types of things. So, but that market is changing dramatically. And one of the things that I'll say to that is that pay attention to these things in the news, right? Pay attention to what's going on, because that right there can lead into some great conversation. You know, even yesterday when Dr. Swiri was going through and talking about employee rights and all of these types of things, you know, last week I saw on the news, and I'm not sure how many of you saw it, that there were some flight attendants or a flight crew that refused to fly because there was some stuff on the fuselage of the plane that they were unsure, you know, it looked threatening, and so they didn't want to, and so they got fired, right? And now they're coming back and suing their employer over the fact that they didn't feel it was a safe environment to work at. These are real life situations, and they change, and the laws that we talk about, as Joe mentioned yesterday too, or the statutes that are in place are continually changing. So keep up on that, right? One of the things that you can do is to improve your standing within the employers of your community is understand the healthcare market that's out there for them right now. It's a scary thing. I said in our session 2 that when I got involved in this whole healthcare arena, top-level decision makers didn't even care about how much the health insurance was, right? It was an insignificant part of the decision-making for business. Now, the money that's spent on healthcare is a primary concern for every decision maker within a company. And so if you understand a little bit better as to what's happening with the healthcare market in general, that's gonna provide them a resource to really have some valuable input into their decision making on a number of issues, on how to improve health and wellness, on how to you know, so I've had companies sit down with me and say, do you think we should be self-insured or fully insured, right? So well, I don't know, I'm a chiropractor, that's a pretty concerning issue, but they valued my opinion because I was aware of what was happening and I had seen what was taking place at other companies, and so we can have some input in that, and that can be very valuable. So certainly stay abreast of all of the changes that are taking place, because they're dynamic. And I think our healthcare industry is going to continue to be extremely dynamic over the next 5 or 10, 20 years, right? I don't know if it's ever not going to be dynamic, because we don't have really good solutions, because as a society we're just not very healthy people. That's what it comes down to. We're trying to save money on all of these, you know, by squeezing the market. We've squeezed Already we've squeezed the employers for everything that they want to pay, and now they're shifting cost. And then what our goal was is to shift the cost to individuals, and now individuals are rebelling against that. The reality is that we just need to become healthier people if we want to have less healthcare expense. But I think that that's a message that we can deliver. As I mentioned earlier, these on-site clinics that major medical systems are implementing, they're no different than their traditional clinics. It's still a very reactionary system. They're just putting somebody on site to take care of the administration costs, but they're still treating people the exact same way. They're still waiting for them to have high cholesterol and then find the right medication for them for the rest of their life, right? That's still the process that's in place for a far majority of these cases. I think that we can do better than that, right? I think that as healthcare practitioners, we can have a bigger impact on people's health and well-being by looking and teaching and coaching and motivating them to improve their health and well-being, not because it's the company's profits that are most important, but it's because it's that individual, right? One of the things that I think has been good is shifting some of this cost to the employees, right? Now that I've got a $2,500 deductible, right? I mean, 20 years ago, maybe the university offered full coverage, and I didn't have to worry about if something went wrong. I just went in and had. But now I got $2,500 of my own money that's invested in the process, right? So now I got to make some decisions as to when I go in and when I don't. And what's interesting is that there was an article in the USA Today just after the first of the year that talked about how these high deductible policies are beginning to backfire because people, what they're doing is that they're not making good health decisions. They're just not going in, right? And they're waiting till it's an emergency room visit or a more severe case. How do you think that's affecting employers in those communities, right? Right? I think that we need to be the voice that says, you know what, let's get on top of this. Let's get ahead of this. And the only way that we can do that is to become really, really easy for those individuals. And by that I mean low cost and easy access. That is going to drive prevention as far as I'm concerned. And our on-site clinics can do that. So when we're talking about the evaluation process, and I mentioned the needs assessment. For those of you who are interested, I'll put this out to you. I've got a couple of these. There's an industrial needs questionnaire that I think is really important for a lot of facilities to do. This is the survey. This is what we do at the Sweary Center here. This is the documentation that we ask the companies to fill out. You're more than happy to come up. I don't have enough of these with me right now to be able to give out to everybody, but if you want to see what we ask people and the process that we go through, that's available for you here as well. So we talk about never overpromise and underdeliver. What is our area of expertise? So my question to you is, right now in your community, what do you feel comfortable doing? That's your area of expertise, right? So what is it that you feel you can go out and provide to local employers? And this is one thing that I would hope at the end of the day, you're writing down, right? What are the services that I want to be able to provide to employers, and what do I feel best qualified to do? If you want to be able to do the BSI examination, right, that Joe talked about yesterday, and that seems like a good idea, then go get the training for that and understand the involvement that's there. I've listed some things that I think that the marketplace is begging for, right? I think that companies out there are looking for neuromusculoskeletal care, whether that be chiropractic adjusting, muscle testing, muscle therapy, patient education, right? I think that neuromusculoskeletal conditions cost employers, cost our country, cost individuals more pain, suffering, and money than it should. I mean, this is most of these conditions are conditions that can be prevented. And so our expertise in that, whether it's addressing them early, whether it's having that early intervention, whether it's that, right, it's that little catch in my neck or whether it's that migraine that develops that continually gives me difficulty, right? Whether it's that car accident that I had that's resulted in a reverse cervical curve that I've never addressed, whether it's that shoulder condition or whether it's that ankle condition or whatever the case might be, I think we're highly skilled. That should be a skill set that you guys all have, right? As practicing DCs, we already possess that. We don't need to go out and do that. Maybe we need to refine our skills. Maybe we need to take Joe's technique on shoulders. Maybe we need to watch his DVD to learn how to handle carpal tunnel, or lateral epicondylitis, or that ankle issue, right? Adjusting that ankle. But really, many of these conditions, and many of those situations are places where we can be experts right now. I think that we also have a base foundation in certainly in nutrition and how we can handle impacting people's health and well-being there. Maybe we need some additional education, and maybe you need to go out and do that, or maybe you're comfortable in that situation right now. But I think that again is another really high volume, hot button topic that employers are interested in providing not just information to the employees. That's again one of the other messages that I want to bring to you this weekend, is that healthcare information is very cheap and very, very available, right? It's the individualization of how can I impact your life with these services? How can I change your nutrition? How can I impact the ergonomics of your workstation? And really bringing that to an individual basis, that I think that our value lies in our communities and working with employers. Because they can go online, they can, anybody with a mouse can figure out exactly how they should sit at this desk, right? What they can't do is they can't figure out how it is that I can fit at this desk best after my car accident, while I'm pregnant, after my shoulder surgery, after my low back condition, right? After the weekend of playing softball, or after my motocross weekend, or the fact that I was in a deer stand all weekend. That's what they can't do, right? That's not the individualization that's out there. That's what we can provide to these companies, and I think that that's what we should be selling to these companies. Again, other hot button areas that I think that we can be experts in is regulation and compliance, drug testing and drug and alcohol testing. How many in here are certified drug and alcohol testing? Right? I mean, that's a great market for us, right? I mean, I think that we need to give really, really a lot of gratitude to the individuals who worked hard to keep our profession in that market, because it is a great way to get into businesses. They have to do it. There's regulations in place where they have to do it. And we're, as a local provider, can provide it oftentimes at a very reasonable cost, certainly better competitive cost than a lot of our medical counterparts, right? And they don't even want to do it, right? So it's an opportunity for us to get patients into our clinic. It's an opportunity for us to have communication with companies. But obviously we need to have the expertise in that. We need to be certified. We need to have the training involved in that. And certainly all of these cases, we don't ever want to represent ourselves as the experts in something we're not an expert in, right? That's the overpromise, underdeliver type of thing. But certainly that a thing that I will caution you at as far as compliance, regulation compliance, is becoming a lot of times, and I've been asked this, is will you come in and will you do an evaluation to see if I'm OSHA compliant? Well, I don't think that in all of my training, I've been through the diplomat program, I've taken a lot of training beyond that, I don't believe that I'm qualified to come in and tell them if they're OSHA compliant, because there are so many regulations that are involved that are beyond my expertise level. You know what? I don't know how long that extension cord should be. I don't keep up I don't keep up to date on all the labeling that needs to be done for every chemical that's out there, and which type of container it should be in, and how it should be, stored, and what type of ventilation should take place, or what's the hearing limitations that need to take place. So I don't go into this OSHA compliance thing, but you will find a lot of local, especially small employers, that'll say, hey, will you come in and, I know you got this training, right? You got this certificate in on-site care, and can you come in and it's, I'll pay you $500 to come in and, give me a report on my OSHA compliance. If you're going to go down that road, just make sure you're very, very aware of what you're getting yourself into, because what happens is that when you file that report, right, then you're liable for anything that you missed. And that's, again, a case where I think we can overpromise and underdeliver. So as far as OSHA compliance, you know, there are people that are out there, there are chiropractors that are really, really good at that because they've really invested a lot of time, energy, and effort in understanding that. But just make sure that you've done that work ahead of time if that's one of the services that you're going to provide. Injury prevention, risk factor identification, and proper lifting. I mean, these, again, are services that I think that we're experts in, that there isn't anybody better to teach employees how to lift, right, than us, right? We should have a great understanding of the mechanics that take place that are out there. There was a question in the break about the power lift program, and we'll touch on that just a little bit later, and the education that, I mean, if you want to really know the best lifting program that I'm aware of out there, it's power lift, right? It's a licensed process that you go through the training, and it's not only proven to work at 1 or 2 or 3 or 4 or 5 or 6 or 7 or 8 or 9 or 10 companies, right? They're signing up national Fortune 100 companies to instill this program. And so that training is obviously extremely valuable. That being said, do you have to do that? No, right? I mean, I'm not saying that you have to do that, but just make sure that you're making the company aware that you know, this is what the expectation should be as you go through. I think that there are a lot of us that can deal in lifestyle coaching or life coaching, stress management issues. One of the things that I think it's easy for us to do in our assessment of employees' health is to look at the physical well-being. We talk so much about it, right? We talk about, you know, structurally where are we at, and what has our injury rate been, and physically where are our diagnosis, and all of these things take place. I would caution you to say that in my experience, stress management is probably the primary cause of a lot of workplace injuries, right? It has a huge impact, not only on the injuries, but on the recovery from injury. So life coaching is a service that certainly we can become experts in, or we can provide some services as part of that. I believe that our on-site programs should include many of these things, right? We can incorporate a lot of these services if we're going to be on-site for a certain number of hours. Yeah. And if we don't have a comprehensive program, right, if all we're doing is going on-site and doing our chiropractic care, that's going to bring some benefit. I think the bigger benefit is to incorporate a lot of these other things, whether we provide those services or we bring others involved, or bring others into the equation and handle some of these other things, we can have even a bigger impact. But just make sure that you're expressing to the companies or the employers exactly what it is your service is doing, how you're an expert in these areas, and really what the outcomes of those services are going to be. I want to spend a little bit of time on scope of practice. This to me seems like a really common sense thing, but I've come across a couple situations where maybe it wasn't as common sense as I thought. Certainly, all of us have state regulations that we need to follow as far as our scope of practice. There's little doubt in my mind that if you engage yourself in working with employers and you're on site at 1 or 2 or 3 or 4 or 10 companies, that at some point you're going to be asked by that employer to do something outside of your scope of practice. Maybe it'll be something that you're not even aware of is outside your scope of practice. Maybe you are very aware. But at some point, some employer is going to ask you to do something outside of your scope of practice. Is it a good idea to satisfy that request? Obviously not, right? That jeopardizes everything that we have in the game, right? I mean, the good and bad about being on site is that when you do really good things, and you're treating employees well, and you're having good success with your care, is that everybody knows about it and you are the hero, right? I mean, you are the person that everybody talks about and it all goes well. When you don't do things well, when you slip up, when you make a mistake, whether you intend to or not, that word gets around as well, right? And that's one of the advantages that the company has in bringing you on site. If a company is going to hire somebody to come on site, the reason they do so is to give preferred access to somebody that they trust. If you lose that trust at some point in the process, that's going to jeopardize the program and the services that you provide. So I would tell you that, that when you are asked to do something outside of your scope of practice, that you're very upfront about that. Not that you don't want to help the employer, but that you realize that this is a limitation that you have as an individual, as a professional. I think that in every on-site program that I've ever been associated with, I've been asked to do something outside of my scope of practice. And maybe it was in the best interest of the company, and maybe it was in the best interest of the individual, and maybe it was in the best interest of both the individual employee and the company, right? There's been that case too. Still isn't a good enough reason to do something outside of your scope of practice. We still have to follow that law. What's that? So an example of that would be this, is that, and again, there'll be a case study later, but this is a good time. So an example of that is I had a senior management, the owner of the company, come to me one day and say, you know what, I know that John out here in the shipping department, something's not right, something's going on, I'm not sure what's happening, he's been missing work, what's going on with him, right? Is he seeing you or what's going on? Well, from a standpoint of patient care, we're not even at liberty to say whether he's seeing us or not, right? And the owner of the company says, well, have a talk with him, get back to me, let me know what I can do to help out this situation. So the owner is asking me to go to John to find out the source of whatever's happening, and then to report back to the owner as far as what this information is. And the owner came to me in an effort to try to do the right thing, right? He wanted to help John out. But it's outside of my scope of practice to divulge patient information, first of all, right? The doctor-patient confidentiality thing that we'll get to. And certainly, it jeopardizes the integrity of my on-site program if I'm communicating on different levels with different people where I shouldn't be. The intent was all positive, right? I mean, they knew John was having a problem, and I knew that John was having a problem, right? I knew exactly what John's problem was. It was the fact that he had a 16-year-old son who was in a boatload of trouble, right? Now, was it my responsibility to communicate that to the employer, right? Did that fall within my scope of practice of treating John or of providing services to the company? All of those things, there's a lot of gray areas that are out there, right? There's a lot of that communication that we need to be cautious of. And in reality, I have been on both sides of that discussion, right? There are times where where my decision making could be called into question, right? And those are difficult spots to be in, because sometimes there are situations where you can say, you know what, well, the problem here is that Sally's supervisor is a real SOB. That's the reason she's having all these problems. But it isn't in my position to say that, right? It's in my position to say, part of the difficulty in the shipping department is that the supervisor and the line level people aren't communicating well. I would be highly cautious of any direct internal communication that you have regarding employee issues, right? And you're going to get them, right? You're going to get supervisors that are going to come up to you. You're going to get employees that are going to come up to you and say, well, what does management really think about this? Again, I think that those are conversations that you're best served at stepping away from. There's a way to be an intermediate in that process. There's a way to say, well, what are your concerns? I'll take them to management, right? And or management, what are your concerns? I'll give you feedback on what can be done on the floor. But stay away from talking about individual individual communication issues, and again, we'll walk through that in some case studies later. Or the other thing is as far as scope of practice is concerned, is that you know, can you just write? An employee will come up. I've had a number of employees come up and say, "Well, can you just write me a handicap card, right? Can you just, I mean, you know, I've got this bad back. It's been bad. You know, can you just, you know, can you sign off on the state handicap card, and then I can do that." Even something as simple as that, what that does is it calls into question all of your other decision making, right? Because word gets out that Louise got this handicap card, and she's not handicapped, and she just uses it to park, you know, at the bank and everything else in town, and she's going around flaunting the card, and now all of a sudden you've put you've put yourself in a situation where all of your other decisions are called into question most of the time. So just be cautious about that, and how you're handling those things. And again, we'll walk through that in some later case studies here this morning too. But federal regulations, again, one of the things that I think is important to remember, and Joe brought this up yesterday in regards to the screening process, you're providing recommendations to the company. One of the things that you do not want to be in the business of is telling them whether they are in violation or not in violation of regulations that you're aware of, right? What you can do is that you can consult them to follow through further in this area or that area. And I say that for a couple of reasons, because I made the mistake when I was first getting involved in this, is I would do an assessment, and then I would tell them where they were in violation of certain codes that I knew, or maybe it was the handling of their chemicals, or some of those things that I had a little bit of information on through the diplomat program, and I'd say, well, you're in violation here and you're in violation there. And one of the things that came back to cause me trouble is that I filed that report with the company, and then the person that I filed that report with reported to the state offices that I had said it was a violation, and now all of a sudden they've got an OSHA inspection involved, right? When we fill out a report on an assessment, and we're talking about regulations, whether they're state or federal or any of those things, really be careful about the wording that you put in your reports. Areas of concern, right? Not areas of violation, right? Areas of concern. That's going to be a really important thing for you. It just helps insulate you against whether it is a true violation and or repercussions later on. It also it does the same thing, right? I mean, it provides the employer the opportunity to follow through and to, you know, and to make sure that they are in proper, within proper code on these things. But just make sure you're really clear that you're not setting that standard unless you're very, very, very sure about the violation. Communication in health and wellness. So here's where we're gonna, yeah. So the question is on payment plans and those types of things. And again, I'll tell you that regulations change quickly, and each state is really different. I know that there's been a lot of concern with the on-site programs that are out there, and I've been asked it a number of times. As a matter of fact, I've been audited on it a couple times. As far as my billing procedure, right, and how do we, you know, how do we bill for the services that we provide on site? I think the safest way to go about your billing procedures as far as patient care on site is that you bill for services that are all encompassing. If you're billing straight for chiropractic, right, then you can get into some fee splitting issues with your clinic situation. And you just don't want to go there, right? Whether you're right or wrong, or whether you want to do right or wrong, I would suggest that you stay away from that. I would suggest, and what we do at the Sweary Center, or what we promote at the Sweary Center, is that we have a billing procedure that encompasses all of our services, whether they be healthcare talks, whether they be, even if you're just doing on-site chiropractic care, you're doing some level of management consulting as well. So incorporate that into your contract with the company, that it's not just chiropractic care, but that's chiropractic care and management consulting. That gets you away from fee splitting issues that a lot of states are highly concerned with. It also gets you away from the idea that you're setting a different standard for a fee, right? Because there are other people out there that are going to say, well, this guy right here, he's only charging, $20 a visit because he's on site. That's what the average clinic visit should be. Well, we don't. I think we stay away from that, right? I believe that we should encompass our services as more than just the chiropractic services, whether we want to include ergonomics or management consulting or employee education or all of these other things that can get written into a contract with a company. But do have a contract that states that the services that you're providing are above and beyond just straight patient care, is how I would recommend it. And
You're not itemizing saying, well,
right.
I was in front of the group for an hour.
No.
Don't even itemize that.
Right, exactly right. Right. So in our contracts, what we do is that we list out, we're going to have 8 hours of on-site care. We're going to provide each week. We're going to have 9 hours each month of management consultation. We are going to allocate 4 hours of that management consultation to ergonomics, and 3 hours of that to employee education, and it isn't deciphered within our contracts how much is directly related to patient care.
Not 3 hours of management at X number of dollars.
Correct.
Per hour. It's just
Correct.
this is
These are the services that we're providing, and this is the fee that we're charging for those services. And that comes directly from legal counsel that I've received with my programs over time. You just want to be cautious about that, because then you get into, like I said, the whole idea of fee splitting and those things. Yeah.
we call it a global fee, or is that not a good term?
That would be probably an appropriate term. We don't use it, but that would probably be an appropriate term.
On that same topic then, for like malpractice insurance coverage, you have to get like an extra policy, say you're as a consultant, you have to.
So the question is, how do we handle our malpractice if we're going to be on site? The malpractice insurance is exactly the same whether you're on site or off site. It's our recommendation and has been based upon feedback from our malpractice insurance people that you just list that as a treating site. No different than if you would have multiple clinics or any of those things. It's your same insurance policy, but it's always a good idea to let your malpractice insurance provider know that you're treating people at this address. Does that answer your question?
You don't have to have a separate policy, because I think
Right.
one of the Nick
Yep.
persons told me, I forgot what the name of the policy was, but it's like an extra policy if you're.
Yeah. Yeah. And we'll go through and we'll talk a little bit about that later too. We're getting a little bit ahead of ourselves, which is good, because these are the questions that you should be thinking about. We also recommend that you have an umbrella policy for your business. So in addition to your malpractice, talk to your local insurance provider and get an umbrella policy, which will cover your business in general, right? So that's always a really good idea, and we'll kind of walk through that a little bit later. But having, and in most of the time, companies are going to get really nervous about what your malpractice insurance is, and that's one of the things that you just want to put out there right away. The standard in the industry is $1 million, $3 million, right? That's exactly what the companies want to hear. It's what their attorneys are going to want to hear. Anything less than that, you're going to get some issues. Anything more than that isn't really appropriate. But yeah, $1 million, $3 million on your malpractice insurance is where you want to be, and you want to make sure that you're communicating that ahead of time, right? So the more confidence that you can instill within these companies, right? The more that you can go to them and say, here's our on-site program, and you offer up these types of things before they ask for them, it just solidifies their confidence that you know where you're going, right? That's, when you walk in there and say, I've got this certificate for this on-site course, part of that is saying you know that you need to have malpractice and that it should be up front and those types of things. And oh, by the way, in addition to that malpractice, I have that umbrella policy, and that umbrella policy not only will take care of my care, but it'll take care of the unfortunate situation where somebody slips off my table and falls, where it isn't due to my malpractice, it isn't due to my care, but there was, they slipped off my table, or those types of things. And we'll talk a little bit about some of those liability issues as we move forward, because they're very important. Companies get really nervous about the liability aspect that they put themselves in front of, for sure. So, Dr. Patterson.
A lot of times, some of my companies have asked me to list on my malpractice that also insured, which is what they do.
Right. Well, we talked a little bit in relation to it, but yeah. So what he's talking about is, as I mentioned, getting in touch with your malpractice insurance, letting them know that this is another facility that you're treating at, and listing that on your policy is always a good idea.
So that was a document that gets generated that the companies want to have a copy of. So it's not just something you add to your malpractice, it's something you provide documentation of for the person that comes to work.
I think the concern is if you're not a stockholder, there's a place where they ask too if it's a company in which you're invested in or operating.
Right, and that's one of the things that Dr. Sweer talked about yesterday, is that we have to be really cautious about companies that we do business with and whether we're financially invested in their profit margins and those types of things. So you're going to be, those questions are going to be asked at most places, for sure. Here's what we're going to do. We're going to take the next 10 minutes here now, and when we come back, we're going to invite Jim into the conversation on a handful of things, as long as we can have him. And if there's something that you want us to address specifically, don't hesitate to bring that up, but we'll get started at the top of the hour again. All right, we'll get started here again. Before we get into the discussion with Dr. Patterson, I want to address one of the questions that came up in the break, and that is, for those of you who are doing DOT screenings, alcohol and drug, and or potentially even post-offer pre-employment screenings, certainly those are types of services that we separate in our billing system, because they're oftentimes billed on a per-person scale, whereas, again, Jim will get into some of the discussion regarding compensation and how we've worked with companies in the past. But yeah, I would encourage you to isolate those DOT drug and alcohol screenings, as well as post-offer pre-placement screenings separately on an invoice back to the company. But trying to, again, keep your chiropractic services in conjunction with your management services when you're billing those out. And we'll talk a little bit about how that goes back and forth. I'll take just a brief moment, because I think everybody here was with us last time when Jim was able to join us as well. But Dr. Patterson is from Red Wing. He's a graduate of Northwestern, about the same time as myself. And Jim and I have had really the pleasure of not only being colleagues, but being friends and having a great source to be able to communicate back and forth in this world of on-site care over the last 15 or 20 years. And that's one of the things that I want to really encourage you guys to do, is to reach out to the other people in the class. Jim and I sat in classes like this, and that's where our relationship developed. And I really, I think that I would say, I don't speak for Jim, but our relationship has been a huge benefit to both of us, both on a professional and personal level. And so reach out to your fellow classmates, because so oftentimes in chiropractic we're this isolated individual out there trying to make our own way in life, and having somebody else to run business ideas by, having somebody else to celebrate our successes, and certainly all of those things are really important for us. And so I just think that that's a big aspect of what I hope you guys do, and whether that's reaching out to the Surrey Center and the resources that we have, or amongst yourself, we hope to encourage those relationships. As you learned last time, Jim has had the opportunity to be on site, providing chiropractic care, providing management services
along with a lot of the other things that we've talked about for a significant period of time and with different employers. And so what we've done is that we've asked them to come back and talk a little bit more to get, again, another viewpoint. Although Jim and I went through the same classes together, our core services that we've offered have been very much aligned. Our programs have been different. And so I think that we want to speak to the fact that the services that you offer and the on-site programs that you have should play to your strengths. And not only that, but should be individualized to the companies that you encounter. And as we engage this conversation, one of the things that I want to have Jim speak to, and you don't know any of this is coming, so we'll see how it goes, is the idea of reaching out to companies and employers and working with people in your community. Where do these contacts come from? Not only necessarily how did he get into his companies, but really the opportunity that he sees for his business and expanding and or for your business. And so maybe Jim, I'll just have you speak to a little bit about how this whole idea of on-site chiropractic plays amongst your contacts and who it is that you engage in conversations with about this on-site care, whether it be business people, whether it be community people, whether it be through your practice in Red Wing, or just speak to a little bit about the opportunities that we have in practice to be able to reach out in our community and share with decision makers and or potential clients the services that we have.
That's kind of a curveball because things have changed so much from the time that Chad and I got started 20 years ago or thereabouts, 15, 20 years ago doing this. You know, back the old-fashioned way is literally seeing faces, and I met probably the most significant person I met at a Kiwanis meeting. Red Wing's a small town of 15,000 people. Most of the larger employers require their upper management people to be part of service organizations, so it was a great place to go for me to just meet other business people. So you got a mix of it actually, you know, people that would join to network that were just private business people, and then you have management people from larger companies. So that was where I met a man named Jerry Dietzman. He worked at a company, and he and I formed a relationship. In today's world, it's different with all the social media, and quite honestly, I've been fairly comfortable in my lifestyle and my practice, and I'm not out actively looking for new accounts very often. And so I have not done anything within what I would say the modern realm of social media, and so I think that depending on your skill set, I mean, that's what you need to do. I mean, some of us older guys, maybe that is still where our comfort zone is, but certainly, you know, if you are younger and that's more your comfort zone is then that's what you need to focus on as far as generating contacts and networking. But sooner or later it does come back to relationships and face-to-face conversations and just meeting people. And it's sales, and so you got to get out and meet people, and I'd encourage you to learn as much as you can about sales. I think that the best salespeople are humble. I think that when I thought about what my two main messages were going to be today, it's about humility and about value. So in whatever the conversation is that we'll have this morning or with Chad or whatnot, you want to think about not over-promising anything, and you really want to think about what value you bring to their team as if you're one of their employees, per se. I mean, you're just going to be a quote-unquote vendor. And I can recall the first time I was I heard myself being described, or my services being described, the same as the guy that fills up the candy machine. Kind of took me back a little bit, but a lot of times that's what these companies think of. They have a lot of people that come in to provide goods and services to their organizations, and they're under this umbrella category of vendors, and you're a vendor, and vendors get changed out from time to time, and maybe you have an opening to get in, and maybe you're in for a while, and then somebody else comes in, and maybe they want to change, and so you're a vendor that goes out the door, and they get somebody else that comes in. So the way to I think to really view this is to really think about the value that you bring to the company. And it has to come from a place of, once again, humility, to bring your best to help them solve their problems. That is my message today in a nutshell. So we can get into some specific questions and whatnot, but always think of it within that context of how you bring value and how you're humble, because they have their whole structure, they have their whole culture. It's a very unique culture to that building, really, that all these people come to work at. And you've got to learn your way around with all the politics and personalities and figure out who's where in this puzzle, and how you can bring value to them and how you can make their jobs easier, not just in a, on paper, like, oh, it says I should make the supervisor's job easier in a production facility. That's a lot easier said than done. And it does come down to making those connections and getting to know those people and their names and something about them, and making that personal connection with literally everybody in the whole pyramid structure of the business. So if you have all the workers down here, line workers, and then you got supervisors, and you got lower management, and you got upper management, and then you maybe have, your board of directors or what have you, CFOs, CEOs, whatnot. You may never even talk to those guys. It depends on how big the company is that you're working for. But it's all about relationship and how you present yourself.
So, again, a lot of what we talked about to start off here, right? Not over-promising and over-providing, those types of things. Jim, one of the questions that comes to mind is when you talk about being humble and you talk about providing value to a facility or an account that you have, maybe I'll have you speak just a little bit as to how you bring that value to the different levels, as you mentioned, right? That pyramids. How do you bring value to senior management? And how does that differ from you instilling value all the way down that chain from your middle management or production level type employees? What changes about your communication, about your overall message, or is there nothing that changes?
Some things remain the same, some things are different. Obviously, you want to have integrity always, and you want to be yourself. But you also have to know who your audience is. And once again, there's different personalities. At this one company I was at, there was this guy, and he was pretty far up the management level, and he was just a real cowboy. And I inadvertently told, it wasn't really an off-color joke, but there were some cuss words in my little joke that I told. And I was a little bit surprised that I told it, but I was more surprised at how receptive he was to that, because he liked that. But in general, that's something you don't want to do. I mean, you want to maintain this level of professionalism. But I was comfortable enough with him because I'd been around him enough over the years. So you have to be a good read of people. And obviously, this is a knack that can be developed, and sometimes it's just kind of a birthright. Some people are just better at reading people than other people. It's really important. I mean, everybody is really unique. I don't really. That's a hard question, because I think that you've got to read every person differently. The further up you go, obviously you're going to give them higher and higher quality of information, more pertinent information. I mean, like what you're going to talk to a patient who's a line worker is going to be way different than or somewhat different than what you're going to talk to the supervisor about. A lot of what you're going to need to talk about is productivity, because that's what these companies are. That's their issue, and that's why you're there, really. In my experience, you're not necessarily there to. You're there to help people be more productive. You're not there to make them healthier. That is the way that you're going to make them more productive, but the company isn't. That's not their. It's kind of both, and depending on the company you work for, they may prioritize one over the other, but at the end of the day, they're a business involved in making a profit, and they need people to be productive. So really, when you're talking about your value proposition, it's about how are you going to make people more productive, not necessarily busier. I mean, people hate to be busier. They're already busy enough. How are you going to make them less busy? How are you going to make them more productive? And you run into a lot of things that are contradictory. Like this one company I worked at, they refused to allow their patients to, or their employees, to see me during production hours. They had to see me during the lunch break or in between shift changes. And sometimes you accept these things and sometimes you don't. In this particular case, I accepted it, and it's the way it's been for 15 years. And just this fall, I got talking to the plant controller, and we got talking about the whole productivity issue, because I've been kind of trying to be a kind of a velvet hammer with management, trying to get them to open the doors to let people see me as needed and not just cram them into these kind of really tight spaces as far as availability, my availability. And so he said, well, you know, if we have a safety meeting and we've got to shut an entire line down, I've got to make a modification to the plant output. And so he says, this is how much a safety meeting for a particular line, this is the modification. Kind of went through all the mathematics for that. That's his job. He knows how to do it, and he just kind of did it in front of me. So I said, well, okay, this is how many people I see a week. I think there's a lot more unmet demand out there. What if I had doubled my on-site presence? What kind of impact would that have on the plant if all the employees were able to see me during production time? So he starts doing some calculations, and he says nothing. I would not have to put any kind of a modification in the plant output. Okay, well, this is what the plant controller told me. The plant manager for 10 years has been telling me he can't do it because of production issues. Obviously, it's not right. It's not true. So how do you talk to this plant manager who's got this mindset? I just found this out about the plant controller. He was generous enough to tell me this. I've never talked to the plant controller before. So the question is, how do you talk to these different people? They're just people. They've got blind spots. And it's difficult. It's challenging.
One of the things I think Jim's story brings out is that when we get on site and we're in our programs or we're providing care, one of the things that I really caution you not to do is to have all of the eggs invested in one individual within that facility. If Jim doesn't reach out to the controller in some sort of casual conversation, and he doesn't know these things, but he can't move his program forward in a better way. And so one of the things that we highly recommend is that when you're on site, know who's responsible for what, and communicate with them how it is that you can improve what's happening or your ideas to affect that, right? So if Jim doesn't go through and propose this question to his controller about what happens if we see people during company time, how does that affect productivity? Now, Jim's pretty sharp as far as being able to read people and when to ask that question and all of those things. But I think that the more we get out, the more we communicate with all levels, right? Whether it's management or whether it's supervisor level or whether it's employees, I think that the lesson to be learned here is that we can have an improvement for all of these areas. And sometimes sometimes what management wants to do and what the employees want are the same things, but they're just not communicating well enough to be able to make that all happen together. And so when we're on site, being able to have conversations with these different levels. And sometimes it's as simple, in my experience, sometimes it's been as simple as walking in to, let's say, a supervisor of the sanding department and saying, what can I do to better improve what's happening in your area? Right? And that dialogue then opens up, well, you know what, you could go talk to the CFO so you can get some sandpaper, and you can go talk to the employees so that they're you know, doing a better job of their quality. And sometimes that communication, even though it isn't our job to walk in and tell the purchasing manager that they need better sandpaper in the sanding department, or that you know, it isn't maybe our job to go out and say, you know what, from a position, you just got to do a little bit better job, and then we'll make these things happen.
Sure.
Yeah.
I want to interrupt you because I want to build off of this sandpaper thing. You need to frame that back to productivity. So because they'll say sandpaper, I've heard this 100 times. and they're just not doing anything about it for some constellation of reasons that they have, whatever those are. But if you're gonna insert yourself into that process in some way or another, I'm just encouraging you to frame it in terms of productivity, because at the end of the day, these guys have their marching orders, and that's literally what it is. These are marching orders, and we're all marching in a line. And if these people can march, you know, more efficiently, that's what's going to make change happen. So frame things in terms of productivity. And that you're going to make more headway with that than anything else. I mean, more so than health. I can tell you that much. They don't really, they're not, to talk about health is really important in an intangible, but it's an intangible, a somewhat intangible thing. So like when you go to make a presentation to a company, you want to think about all the tangibles and the intangibles, right? The direct costs, the indirect costs, those 4 things. So it's the fact that somebody's healthy in their health, that's somewhat of an intangible. What may more directly tangible to them is productivity. And so they'll do something about health as it relates to productivity, but beyond that, it's kind of like their own business. I mean, like, we provide health insurance for you guys, you just go take care of yourself. There's a lot of complexity about providing health care to employees in the first place, as you know. And so it is all about productivity. So once again, value. What kind of value are you going to bring? Be humble about how you approach these people and how you can help them. If you say, how can I help you? I want to help your plant to be more productive, your employees to be more productive. How can we work together to facilitate this? That's kind of the language you're going to want to use.
It brings up an important point, right? So oftentimes we think of, and we've talked about even in this class, that companies are interested in reducing work comp costs or injury rates or those types of things. So I believe that most companies are really focused on that. But once you get in and you gain the respect of these employers, focusing your attention and your recommendations based upon the improvements in productivity or business profits is extremely important with that management group, right? That's where things are, you know, maybe as you said, they've known for a really long time that, you know, there's been a lot of complaints about the sandpaper, but they didn't want to spend, you know, the extra $100,000 a year that it was going to cost to upgrade that sandpaper. When we come in there and we say, you know what, I really think that we can have an improvement in production that's going to exceed the expenditure, right? And especially if you had an opportunity to prove yourself in other areas, that's when you're going to get the voice that comes through. My experience is that when you're initially on site at the company, stay focused on doing what you can and ask for how you can improve. Over time, you'll gain the confidence, and then at that point, provides the opportunity to expand that discussion out to a point where you can start making some recommendations in some other areas. Jim, one of the questions that comes up a lot for us in relationship to services is how do we go about setting our fees and all of these difficult things when we're not sure what the marketplace is going to have or those types of things. Talk a little bit about how your program has evolved over the time or where you're at from a billing standpoint. Really, there's two different, well, there's a couple different ways to go about it, right? For most of my career, what I've done is I like the word global charge, I like to use that now. So I've had a global charge, right, where there's been a monthly stipend fee that's been involved, and I don't isolate it out in all of those things. Most of the other health and wellness people out there, safety people, are consultants charging an hourly rate is pretty typical as well. But what's your thought process, Jim, in addressing that?
It's evolving, and I would say that my view now is probably in the past it was appropriate, but I think the view that really makes the most sense to me in today's world is you have to measure what you do. You have to have a collection of metrics that measure what you do, and once you gather a bunch of data, you can kind of just have a conversation with the company that you're working for and then determine value from the data, right? So the data is, you know, how many people are you going to be are coming in to see you? Well, let's measure that. Let's measure participation, okay? Let's measure some outcomes. Let's measure how much it takes for a particular case. So let's just say your average visit seen to take a case from the first visit to completion is 5 or 10 visits or something like that. So it's a per case number, right? And then let's do some cost comparison. What does that cost to have that done at the local medical doctor, physical therapist, the local chiropractors? And let's gather some data and some information. I think because that's going to be a moving target. The marketplace is always changing. So I think that the most important thing you can do is think about different ways that you can measure your value. And then you present those, and then as a result of that, then you can have a discussion about compensation. And that compensation should be based on the value that you're bringing to the organization.
So last time, Jim, we talked a little bit about how you got involved in this and your first contract. And so when we have a program on site, when we have track record, we have outcomes measures, it's easy to set evaluations. But maybe speak to a little bit of why you feel companies have taken on your services without having a track record, right? That's where so many people are. What factors do you think companies invested in your services?
Well, actually, now that we're talking about this, I break off the rust from my memory banks. I did kind of do those things back when I first got started in the late 90s, is we did look at what the current charges were for physical therapy services and for chiropractic services, and then we arrived at a number. There's one of the companies I worked at, I got paid an hourly rate. Another one I got set up, and it was a monthly rate. Or now let me think about that. That was maybe an hourly rate for the first couple of years, and then we changed it to a monthly rate once we got things established. That's how I did it. So you have to have some kind of data out there, and then you're going to make a presentation to say, hey, I think I can do it for this. But what I'd caution you, or what you really want to look at is, it's difficult because you're going to cost way less than a medical doctor, right? But you're going to cost the same or maybe a little bit less than the local chiropractor if you're going to undercut them. But I think that you have to be really careful with that because that's kind of a race to the bottom. And I don't know that you really want to have that as your business model, race to the bottom price, right? And that's why you really want to focus on value, and you want to focus on productivity, because actually lack of productivity costs a lot more than the care that you're providing. So one of the companies I work for right now has, they've been hiring a lot of people. Every week I do a presentation to a group of new employees. And one of the examples I give them, and I talk to them about when you have to make a decision out on the floor about doing something fast or doing it safe. I always talk to them about the importance of doing it safely. Because I said, let's just say there's something you've got to move or pick up, and it's going to take, you look at it and say, this object has to go from there to there. And I'm in a hurry, and I think I can do it myself, versus asking a coworker over here to help me do it, right? If you do it yourself, you're maybe going to save 10 seconds, maybe at the most, right? Because this guy's got to come over and help you. That's going to take 10 or 15 seconds more. It's going to decrease his productivity, right? But then I tell him, I say, well, what if you get hurt, and now you lose a day of work, a week of work, a month of work, a couple of months of work, a year of work? And I've seen, every company knows this. I said, they have armies of accountants that have figured all this out, and they'd rather have you take the 10 seconds over here to do it safely than to do it wrong and take the risk of you being out of work and not being productive. They've got to hire somebody to come in to help. They're short-staffed. Their efficiency goes down. Their quality goes down. See, it's way more about that. So that's part of the value that you're bringing. So that's why I want you to focus on value. So it's not just about price. It's like, what are you doing? You're coming there to help them have a more efficient and productive operation. And that's part of your value proposition. It's not just pricing. Pricing has to be part of it because it gives relevance, right? But they know all this in the back of their head. Maybe it's in the front of their head, but it has to be tied in to what you're doing. Because what you're going to do is, you're doctors, you're going to bring them health. And health is going to help them increase their productivity or have less inefficient productivity.
Either of you tell us how your companies track your value, how you impacted it when you initially started, and then what did they do on an ongoing basis to make sure that they were getting their value out of you? How do they track your productivity, your impact on their bottom line? I'll start off because I've got a really good story that fits into some of what Jim was just talking about. Is that the very first company that I ever walked into, right? This was a brand new idea, brand new concept, and had really no idea what was going on at the time. I had some classes, and we just thought that the idea of bringing on-site care was pretty smart. It's just, we got a chiropractic clinic that I was working at, and we thought, well, let's bring this chiropractic office into the place of work. We thought it could take care of their headaches and reduce their absenteeism and treat people at work, and it was going to all be great. And they had some high work comp costs at the time. And so when we initially started the program, what we did is that we based our pricing structure not on value. We based it on marketplace, right? What was it to see somebody in the clinic setting? And what we decided is that if we can, we'll sell them on the idea that we can beat that by 20 or 25%. And they initially thought that was a great idea, right? Then we would have these people anyways. And initially it was extremely successful, right? I think that my on-site collections were $30,000 a month or something ridiculous like that. Right? It was fabulous. What happened was, in that situation, is that we kept with that pricing structure to a point where we drove down their work comp and we drove down their absenteeism, and then we didn't have any way to add value to what we were doing, right? So now they were spending $300,000 a year when they had work comp, low work comp, and they had no absenteeism, and they had all these things take place. And so to Don's question, what we were able to do, thankfully, in this situation is to change the mindset of where we were bringing value back to that company. Along with that, changed kind of the pricing structure and how we were able to do it. We went to a more global fee structure as opposed to a fee for service of individual, because we could tie in more of the production issues, right? So that's where we made the change from going from being, we're going to drive down work comp and we're going to reduce absenteeism, which were their two biggest issues, to switching over to now we need to show you that we're having a higher level of productivity. If we would have kept our fee structures that same way, if we would have kept tracking the fact that our work comp costs were low, they were looking at us like, why are our work comp costs are $20,000 a year? Why are we paying you $30,000 a year? Well, the answer to that, or what we were able to do at that point, was to be able to change that discussion into what Jim was talking about earlier, as far as adding value to the production side of things. Now we're going to measure production issues, and if we can meet our production goals, that cost is tied into that. And so I think it changes over time. Is to your point, Don, is that if you go into a company and you do your assessment like we've talked about, and you know what their major goals are for their management team, is measure those goals to begin with. What you got to do to get in the door, you got to do to get in the door. But don't be satisfied with that, is my point. Is that constantly look for how you can add value to your services. And sometimes that means coming back the next year and saying, you know what, in addition to what we were tracking, we need to track this. I guess that's how it's working for me. Add something to that, disagree with that?
No, I think that, the whole idea, like, we could tell you some cookie cutter thing, essentially give you a fish for a meal, right? But what we're hoping to do is teach you how to fish. And how to fish is to collect metrics, collect data. You need to think about what's important to them. Ask them what's important. I mean, you can get a list of all kinds of different things to measure. Like, say, absenteeism, for instance. That has been on every HR person's radar and production person's radar forever, right? And they do all kinds of things. So you can't necessarily say that, oh, since my program has been here, there's X reduction in absenteeism, and attribute it to what you've done. They've got 5 different ways that they're approaching that problem already. So these are all important pieces of the puzzle, but that's why you have to measure a number of different things and take them into context, because they'll have to reduce work comp. I mean, they've got safety programs out there. They've got all kinds of things that they've done in the past, that they're doing right now, that they're thinking about doing in the future. You're just one piece of the puzzle for them. So, but your impact can be across this, and they understand that. So they'll say, well, if I can get maybe reduce of all the reduction that I get in absenteeism, I'm going to attribute some of that to this wellness program, and maybe some production gains over here for some other reason. I can attribute some of that. So you want to be part of the conversation. You want to have what you're doing. You want to frame it in such a way that it ties in with all their other programs that they have. And so you've got to think about, you've got to do some reading and some research on your own as far as what's important to these companies. Then when you talk to them, you have to find out what they're specifically interested in, and then maybe you can add some things to the conversation, maybe some things that they haven't thought about, but most of the time they've already thought about most everything. And just add that to that. And you want to measure all these things. A lot of times they're not measuring things. One of the companies that I work for, I mean, like management, I think I shared this with you the last time, there's a revolving door. People get promoted, people get demoted, people get kicked out, new people come in. And so there's all this that's happening all the time, and the more that you can track this and show that you have a steady track record of participation and of outcomes, and when you ask and do a survey and you ask them how this impacts their ability to do their job, that's a super huge question. And if you can track that and say, now you've got something that is solid, that's going to last throughout all these different management changes, personnel changes.
one of the really important things to remember in that light is that the idea of collecting some baseline data when you come in contact with these companies is extremely important. Getting a starting point. And sometimes what happens is that starting point will change. And a year into your program, you've got to collect different data and a different starting point. But don't be discouraged by that, right? You know, like Jim says, if you're having most of the time, the management structure of these companies, they're going through options. They're talking far before you ever walk in the door. What they're trying to decide is that does what you're saying, what you're promoting, or what you're offering up as services, does that meet in with their philosophy and with their ideas? And so, the best way that you can sell that process is to make sure that you get them to communicate with you as much as possible. One of the things that I think is really important when you engage in conversation with these companies is to do exactly the opposite of what you want. What I wanted to do when I first got involved with these companies, is I wanted to go in there and I wanted to tell them how great I can be, how much I can do for them, how this all made sense in my mind. And I just wanted to talk and talk and talk and talk and talk, and I thought that that's what sales was, right? I thought it was me getting up and getting a presentation that was going to convince them as to what was right. And I think one of the most important things you can do, whether we're talking about collecting the right data or whether we're talking about ensuring the sale of the program, is to give them just a little bit and then sit back and listen to what they have to say. Because the more that they can talk, the better you're going to be able to fulfill the needs that they have. And the better that you're going to be able to say, this is how I can change productivity, this is how I can improve absenteeism. And so really, it's difficult, or at least it's difficult.
I want to jump in on that. This is where your preparation comes in, is to be a good listener and to be a good question asker. You have to be able to ask really good questions and then sit back and listen. The hard part about that is you don't necessarily have the experience. But in order to, what you have to do to make up for the lack of experience is to do your homework ahead of time and look into all this stuff and read as much as you can and to get a lay of the land of what's important to these corporations. And you've got to read a lot of journals, and you just got to read a lot. And so that you can ask those good questions, because some people just like to hear themselves talk. And I've been in meetings where somebody just launches and you're just like, really? 15 minutes on this? It didn't advance anybody's objective whatsoever, and we just spent 15 minutes on something. I only got an hour time. So it's you got to ask, even when it comes to listening, once again, it's being able to read people, and you don't want to necessarily, sometimes you might have to interrupt and try to guide the conversation to the best of your ability to keep things on track. So listening is super important, but you got to be careful too, because there are talkers, and then there are people that are listeners out there too, the introverts that are at the table. They don't talk anyways. How do you get them to even say what it is that they're thinking? It's hard to get them to even talk. So you got to kind of, and who's who? A lot. Like when you sit at the table, who's the decision maker? It's kind of interesting to understand that dynamic, because everybody, like once in a while, a question will get raised or a comment will get made, and all of a sudden everybody's eye shifts to a certain person, and then where it's at, who's in charge. And it might not be the person who's in charge, with a title. It might be somebody else who has more influence.
That's a really important thing to pick up on, is that when you're in meetings, right, and you might be meeting with the production manager, and you might be dealing with the financial guy, and the CEO, and the HR person, and picking up on those nonverbal communications is really, really important. I can think back to sitting in on a meeting where I was trying to get an on-site program involved, and I went into the meeting thinking it was a financial decision for them, that it was going to come down to the numbers, and if my numbers, if I could convince them that from a numbers standpoint, it was going to be something that would work, that we were going to get, that I was going to get the sale. But within the first 10 minutes of the meeting, it became very apparent that financially I was in the ballpark. They weren't concerned, right? They had already. The reason I was there is because they had already okayed the financial aspect of it. The bigger aspect came in line with did the production manager believe that this program wouldn't disrupt what was going on? And so, if I would have picked up on that in those first 10 minutes of that conversation, I would have spent that entire meeting trying to, communicate how financially this was going to work, when that wasn't the question that they were asking. And it wasn't that anybody said that to me. It was that every question that I asked, or every comment that we discussed, was referred back to the production manager, and it took me, it took me 4 or 5 times to realize they kept asking him how it affected things. They weren't asking the CFO, right? They weren't asking the financial guy. Right? They weren't asking the HR person. What they were doing is they were asking the production person as to how it would affect things and how it would affect things. Well, what do you think about that? Did that work? Or did this work? And so it became very obvious, 15, 20 minutes into that meeting, that was the person that was the decision maker amongst that group. Was he the top level decision maker of that company? No. But the top level decision maker, the owner of the company, had made the decision that everything else was okay if he got the okay of the production manager. And you'll see that takes place a lot on the site as well, is that it isn't always convincing the top level people, but it's convincing somebody else that reports to that top level person. That becomes extremely important. And so sometimes it's not always that verbal communication, or they don't come right out and say this is going to do this, but you have to read that into the discussion, certainly the nonverbal communication that takes place.
So I want to build on that.
Just a second. Is that the numbers are important, and what's kind of interesting just about us human beings is that we all say that the numbers are important and we want numbers. And when you talk to business people, they'll say it's all about the numbers. It's all about, we're a numbers-driven, data-driven company, And they are, and the numbers have to line up. But it only takes that long to see if the numbers add up or if the numbers don't add up. And when it comes to decision making, you guys should know that it's emotional. It's not rational. And so they're one of the biggest questions that is going through their mind is, do I like this guy or this gal? Am I going to be able to work with them? Are they a good fit for our organization? What's their personality? That's a huge thing. When they don't want to make a commitment to you, it's not like you're at the grocery store buying meat at the meat counter. You're going to be there and part of their team. They want somebody who they resonate with. And not that you can resonate perfectly with everybody, because there's this whole spectrum of personalities. Everybody knows that within these organizations. But when you're talking to these key people that are part of the management team, that's really kind of the primary question. I mean, the numbers are what the numbers are. Anybody could make a presentation with the numbers and make the numbers look good or whatever. But this whole other softer side of the emotional side of it is really, really important. So it gets back to this humility. How can I help you? I'm here. I've got these are the more objective things that I can do for you. But really, how you want to come across as a person is from this kind of a humble point of view. I'm here to serve you. How can I do it better? These are the things I think I can do for you. It's all about what I can do for you. It's not about what you can do for me. You can't go in there thinking, geez, this is a great opportunity for me in my career. And I know that's in the back of your head, right? That's why you're here. You want to increase your business, right? That's kind of your motivate. That's your real kind of motivation, and they know that. But when you're there, it's all about them. All about them. The minute you start to kind of veer away from that, you're going to start to lose them. And the further you go down that path, the more you're going to lose. It's really all about them.
One thing that's been very apparent.
Oh, you had a question.
So I've heard both of you say, and Joe say too, about issues about productivity. And their questions of productivity is, you being there, how's that going to interrupt productivity? So are they concerned about the amount of time that a person's in your office getting the treatment? So the question, so that everybody understands, is, you know, in relationship to productivity, and if an employee is coming off the line or away from their job responsibilities, is that a major issue as far as lost productivity that's involved? Sorry, should I?
Go ahead.
I'll tell you that I have had cases where management has come to me and said, how come every time Dave goes and sees you, he takes 45 minutes to get back to his job, and every time anybody else sees you, they're back to their job in 20 minutes? Those issues will rise, right? And so you need to be efficient in your treatment, right? You need to be, and if somebody requires care that is beyond the scope of practice that you can take right on site, then that needs to be a referral situation. But the far majority of the treatment that we administer, that you guys administer in your practice, you know, it shouldn't affect most of production. And it's been my experience, all of my programs that I've had, the employees have come to me during company time. And as long as we've been efficient about the care, the benefits have always proven out to be positive on the productivity side. And the companies that I've worked with have always been extremely aware of the fact that if we're seeing somebody in company time, they're getting that time back somewhere, and they're not losing on productivity. But it might change depending upon the industry you're in. If you, for instance, some of the companies that I've had, a department is completely reliant upon all 6 people being on that line, otherwise the line's got shut down. So you need to be smart about that, right? You need to make sure that you're communicating with that, hey, you know what? Anything we can do to see you in a time that you don't have to shut everything down, that's going to be better for everybody. Because we don't want to shut all of those people down. But yeah, it's been my experience that all of our on-site programs have resulted in positive productivity. With the exception of an individual patient taking advantage of the situation, and those need to be addressed on an individual basis.
I think it's a great question.
And to be honest, I don't have a perfect answer for you, but I know that there's a way to think about it. And I did a presentation to a guy a couple of years ago. He had a small company in Red Wing, and it didn't go anywhere. But he made we were talking about productivity. He goes, I know I don't get much productivity out of these people, you know. And that was just his comment. He owned this business. He had about 30 employees. And he was very realistic about that. He knows that people sit on their phones and do personal things. And he knows, I mean, you got to go to the bathroom. You're not getting, you know, like, you got somebody at a production line, they got to go to the bathroom. I mean, like, yeah, they try to go on their breaks, but, you know, if something comes up and you got to go, right? So I think you can talk about it in a number of different contexts and ask them how they measure things like people going to the bathroom. How do you account for that? Okay, so that's a good example, like, because that's about how long it may take for them to come get a treatment. You know, talk about somebody being on light duty. Well, okay, how do you adjust your production expectations on this, or is this something that you just kind of don't like but turn a blind eye to? You know, what about somebody who's just actually off work for a number of days or weeks or months due to a job injury, or not? And like, how do you account for somebody who has the flu and is out for a day, and how does that all affect things? Somebody who calls into work because they've got a headache. And ask them questions like that. See, those are good questions, because you kind of feel like the focus is on you, and you've got to prove how, you know, you're this isolated case where you're the only thing that distracts from productivity, when that simply isn't true. And I think you kind of have to open it up into a broader context and say, well, let's talk about productivity. How are you actually measuring your losses of productivity due to all these things? And let's keep it in the broader context of, okay, what are you getting if this person stays home because they have a headache? What has that gotten you? Versus if the person came to work with a headache and we gave them a treatment and it took 10 or 15 minutes and now they didn't have a headache and they were here all day. So I think a couple of examples like that, but the way that you bring that up has to be from a very kind of neutral, humble, value-based, service-based tone that you have to express these kind of questions and ideas and pose these different scenarios when it comes to productivity. Because that productivity one, that one's been hanging over my head for years on different things, and I have not been successful very successful at getting my points across, because you only have so many snippets of time. People have a very hard and fast belief system about their own particular take on an issue, and it's hard to penetrate that sometimes. When you first come in, I will say this: however you get your program set up in the very beginning is crucial. Get it set up right from the beginning, because I have run into so many areas where it's been a glass ceiling. In this productivity one that I mentioned earlier about getting people to be able to come to see me on shift, I just basically stopped trying. Once in a while I'd throw something out to somebody to say, hey, we should really be doing this, but I kept bumping into this glass ceiling, because the way I accepted the terms when we first got started, that was the term, that's the way we've always done it. We've all heard that excuse, right? That's just the way we've always done it. And so you want to get it set up right from the beginning and ask these questions and probe it out, and so that you can do it right. Quality is super important.
Joe, you had a question? Go ahead.
You're saying get it set up right from the beginning, and both you and Chad have said, you have different accounts. How do you know, okay, this place needs 2 days a week, 4 hours, whatever, how do you know that? If you've never done this before, you're like, okay, I want to get it set up right, or how do you know?
Okay, great question. And the way I would say that is you get your metrics set up that we're going to measure this. And I think the best way to do that is you have to survey people. And really you do a blanket survey and say, what are your needs? And you ask all the employees, what are your needs? What works for you? And so then you propose to the company, let's do a pilot project, okay, of this amount of time, right? And then let's measure and find out if this is the right amount of time that I'm there or not, okay? Well, in 6 months, we'll do another survey. We'll see if we need to cut back, see how busy I am. Maybe I'm not very busy and I got to be here half as much, and accept that, because that's serving them, right? Maybe it's double. Maybe you need to be there twice as much because you're just full and there's all kinds of people that still want to see you. But if you get it set up on quality and get your outcomes good and your service high quality, then don't worry about the volume. Worry about quality and measuring that, because it's going to change. When I started at Red Wing Shoe Company, they had over 900 production people. Within 2 years, it was down to 500, because it was right around 2000, 9/11 hit. There was a big crash. Things opened up with China, trade, early 2000s. Tons of manufacturing left our country, tons and tons of it. They went from 900 to 500. So my hours got cut sequentially in that time. And they just said, well, it's a percentage. I mean, if you were here for, I think when I first started working for them, I was there maybe 14 hours a week or something like that, 14, 15 hours a week. And sequentially then it was 2 less and 2 less and 2 less until it was half of what I was, because they'd half the price. And that was their metric. That's how they determined. And it was just happening, and it would happen behind closed doors without my involvement. Somebody would come up to me and say, well, starting right now, you're 2 hours less. and then, you know, 6 months will go by, and starting now, it's 2 months less, or whatever, as things got ratcheted back. And they had already made the decisions, and they weren't even pulling me in to see what I thought. Had I had a metric system set up, or let's ask people what they need and what's the demand, that would have been different. So get the right metrics, measure the right things from the beginning, so that you can maintain the ideal, the sweet spot, the Goldilocks program for them. It's in their best interest, it's in your best interest, and it's flexible. Measure it.
The point that Jim brings up is just really spot on. We've talked about in this class how we want to create a win situation for the employees, the companies, and ourselves. And the only way we can do that is by measuring these things. And for those of us, and Jim and I have been doing this, with new accounts right now, I'm taking the same approach that Jim explains, is that here's, to the best of the knowledge that we have right now, this is what we think we're going to need, right? We think we need 8 hours a week, right, for this company of 210 employees. So that's the best of our ability. But the part in setting up the program that's really important is the communication to say, this is going to be a pilot study opportunity for us to go ahead and see if all of our assessment is working. We understand that 6 months from now, a year from now, 5 years from now, 10 years from now, things are going to look significantly different. So we're going to continue to track things to tell us how we can provide the best value to you as a company. That's the part that when we talk about setting up a program, is building in that flexibility and having that communication so that this is our starting point, but that we need to go through an evaluation and looking at the numbers so that we can change things over time. Instead of saying, you know what, this is the way the program's going to be, we're going to move forward, and if we're not measuring anything, it's tough for us to justify the changes at all. So I think that that's a really, really important thing to do when we start programs, is to have a communication that, hey, this is a flexible situation. It's in the best interest of the company to be flexible because it changes in the number of employees or the business or however that changes, and or sometimes what happens is the demographics of their employees change. I had a company where in that same time period when they really cut back, we went from an average employee population where their average age was in the late 20s, and then they went through, it was a union facility, they went through significant layoffs, right? Got rid of all their young people. So now our demographics changed from that late 20 something to a mid 40s person. Well, if we were doing the same program with both of those people, with both of those demographics, that's trouble, right? But because we had in place to measure those things, to be looking for those things, we could be flexible in what our recommendations were for the program. So we needed to see a higher volume of those 40-something people because they weren't as healthy as the 20-something. And the health issues that they had, we needed to develop health education and other programs in place to be able to address their bigger concerns as opposed to the concerns of the younger demographic. So I think when you're setting up a program, and not only setting up it, but as you continue a program, don't ever get complacent about measuring these things and constantly looking at trying to add value. The way you add value is to be flexible and meet the needs of a company.
A lot of what you do should always be focused on creating goodwill. Goodwill within the company. But then that goodwill extends to your community. And depending on what size community you're in, that's worth more. So let's just say you go work for, you're in a small town like mine, and you're working for a company and they really like what you've done. You might not get expanded hours at that company, but you might get another contract because guess who the plant manager at this company, he's talking to the plant manager at that company. And these guys, especially like in my town of 15,000, they all know each other and they all talk to each other. They have regular meetings all the time. They share ideas. And so creating goodwill is really important. It's a very kind of a, I don't know if it's tangible or intangible benefit to what you're doing. So get it set up right, have the integrity, have built-in flexibility, measure things to the best of your ability so that you can move forward. That's what businesses do all the time. They're constantly measuring things, and they're constantly adjusting things. And you're just, you know, part of their whole bigger picture. You're a piece of one piece of their puzzle, and you want to bring that value to this new piece in.
Well, Chad and Jim, I'm enjoying this immensely. Jim, I'm not sure how long you can stay, but I'd like the feedback from both of you. And this is that sensitive question that we've chatted about a number of times, Chad, and that is for the practitioner to recognize when and how to deal with the sensitive nature of distinguishing wellness care from a true bona fide work comp situation. A lot of these are gradual onset, right? A lot of these are, you know, repetitive microtrauma kinds of disorders, overuse disorders. And then when does it convert from your regular twice a week wellness care? And then how do you deal with it? Because that's when there's legal issues, right? And that's what this weekend is focusing on. So I'm sure everyone would like to have some discussion from both of you on that.
You want to start?
Yeah, you know, it is a gray area, right? You know, so what Joe's describing is, you know, when does a condition become a workplace injury as opposed to a non-workplace injury? And what defines that, and how, as a practitioner, do we differentiate between that cumulative trauma condition that might be influenced by the work that they're doing, might be influenced by the hobbies that they take, or might be influenced by their lifestyles that they have outside of work too, and how do we define a workplace injury? Again, I will tell you that there's a lot of gray margins in this market. The legal stance, and we'll cover this in a while here too, is that a workplace injury is a direct result of employee's responsibility and takes place at work. Now that being said, they might have a number of pre-existing conditions that make them more susceptible to a workplace injury. And so it's always my contention that we want to engage the employee in healthcare prior to a directly relatable situation to work. So we want to take care of that low back case, right? Maybe they've been lifting 80-pound bags of feed all these years, and that's accumulating into some breakdown. Legally, what happens is that it becomes a workplace injury at the moment that the employee can directly relate an activity at work to the condition. And so at that point, it becomes a workplace injury, and it needs to go through the entire system there. My contention is that we want to be on site, we want to take care, we want to engage that employee in the conversation of those subclinical conditions, right? Maybe it's not, you know, an acute care situation, and resolve those cases as quickly as possible. But there definitely is gray area, and the law will tell you that as soon as the condition is directly related to the employee's work, that's when it becomes a workplace injury.
Okay. What I will tell you is that a lot of companies, back when we first got started, and things change in a society, and I think that how things have changed in the business community, and I think that their understanding is evolving. When Chad and I got started, they were more focused on reducing work injuries. Okay, and taking care of work injuries in a way that cost them less money. So when Chad and I first got started, this was our focus, and so it was really, really difficult because you had to wade into these gray areas, and everybody had to kind of be comfortable with whatever level of gray you were in. Well, you got these changing people in management and this, that, and the other thing, and this gets to be kind of a really iffy world. What I would share with you, my own personal experience of where I am at right now when it comes to this is, because I had a shake-up at one of my companies a couple of years ago. I now believe that you're best off playing it pretty closer to the law than not. And that I would also propose to you that the majority of injuries that happen to people are outside of work and not at work. And if they're at work, it's due to poor policy and poor ergonomics within the workplace. So really, I think that work injuries are best reduced by management controls and ergonomics. And I think that there are plenty of examples out there, big companies that have put in better policies and done better with their ergonomics and have taken their work comp numbers from the attic to the basement. They don't need chiropractors to do that. Matter of fact, it's not going to work, because if you have a work injury and you bring in an on-site chiropractor, it's still a work injury. And you can do all the wellness in the world, but if that workstation and that work environment of that company is crappy and they've got some guys lifting 70-pound boxes all day long, you can do wellness all day long. That's sooner or later going to be a work injury because it's related to lifting those boxes. Let's just be real about it. So really what I think that you want, where I've shifted my focus and attention, is to general health care. And when I do my presentations to the new employees, I talk to them about previous injuries, and I talk to them about being proactive, because that's where my clinical services are most appropriate for these companies, is to treat non-work related conditions and to treat people with the smallest of symptoms. Because when their symptoms are small, they're not going to cross that threshold where it's going to be a work comp case. Okay? There still might be a quote-unquote related aspect to it, but that related aspect will be pretty small. And this is a cultural thing of that company. And if you can get involved, and this is where we talk about getting the company or the program set up correctly, is this is a proactive program. We want people to come in when they've got symptoms that are on a pain scale of 1 to 10, a 3. 1s and 2s, don't worry too much about. 3s and 4s, we want to see them, because by the time they get to be 5, 6, and 7s, we can do a tremendous amount for those people. But this one company that I works at right now, that's off limits for me. Somebody comes in with a hot low back and they got pain of a 5 or a 6 or a 7, I know I could take care of it instantly. You know what the company's point of view is on that right now? Watch and wait. See what happens. I can't hardly stand it. But that's where the legalities of it are. And that's what they've chosen, where they're not going to wait. The management prior to them was willing to wade into the gray. Well, turn a blind eye, and I treated it. Not anymore. So it depends on the company, it depends on the management, it depends on you. Depends on the questions you ask. It depends on what you put in your notes. I mean, it's the elephant in the room. I will tell you, we can tell you all the great things that we can do for companies and the care we can provide, but it's the elephant in the room when you go to these companies, because if they're sharp at all, they know that that's the issue. And how do we take care of work injuries without taking care of work injuries? So what you want to do by taking this course is learn about policies that are good policies that actually prevent injuries. You want to learn about ergonomics, that you can get out on the floor, and that's part of your value proposition, to go out and to teach people how to use their bodies better, be able to recognize poor workstation setup and be able to communicate it in such a way that it gets done. And you know what the key to that is? Having a good relationship with the maintenance department. Because if nobody has a good relationship with the maintenance department, that's not getting fixed. So it depends on how that hierarchy is set up within the company. When you have somebody that comes in to see you and they tell you about a work-related problem, and then you go and tell the safety person about the work-related problem, what kind of relationship does the safety person have with the maintenance staff to go get this corrected? This is a really, really big part of your value proposition. And it doesn't have anything to do with manipulation. You can't, you know, you need to stay away from manipulation, which it was the easiest thing to do, but because of the law, it makes the most sense to do clinically just in so many regards. You take this person with this hot low back, it's a pain of 6 out of 10. You know you can treat it 3-4 times and it's going to self-resolve and it's going to be a beautiful case. Case open, case shut in 2 weeks, right? No harm, no foul. But you can't touch them. What's your value proposition of the company? It's talking about policy. It's going out and talking about ergonomics, getting out on the floor and doing ergonomics, and it's talking about doing preventive, non-work-related health care. Because the work-related health care that you're limited to doing, to not make it be an incident. Now that's federal OSHA, right? Incidents. That's their biggest concern. The money, the truth is the money, these guys are less concerned about the money than they are about the recordable rate. It's crazy, but it's true. So that's the one that you got to key in on. So at this particular company right now where my hands are tied, I do all kinds of massage because you can do massage. And of course I'm doing myofascial release and I'm getting in there. And once in a while things just happen to move, you know. The joint just happens to move while I'm doing the massage. But that's what I'm doing, all right? As far as, I can't say, hey, that adjustment is the thing that just fixed you. You better be careful with what you say. And it's ironic, we're chiropractors, right? We want to say, hey, it's that adjustment that just helped you out. But in this environment, it's a gray area.
One of the things that are certainly an approach that we were, again, gets back to our discussion about setting up your program to begin with. The conversation that we have with the new company is that in all likelihood, when we come on site to provide care, there's a really good possibility that we're going to have a spike in this incident rate. And that makes them extremely nervous because they don't want to see that at all because it affects their rating and all these types of things. But it's my philosophy that we need to be open about that we're going to come on, because those injuries are already walking around their facility. It's just, they're waiting for those injuries to get more significant so that the individual goes into the local practitioner as opposed to being so inside. When you come on site, it's just easy and convenient for them to come in. So you're going to see, and this is something that we talk with companies about, the likelihood that at the beginning of our program we see an increase in incident of work-related injuries because they're already there. Not because we created them, right? And it's not because we're initiating them. It's just because we're more convenient now, and so those are going to bubble to the surface. But our positioning on that is, yeah, we might see a few more of these cases, but then let's take care of them where they are right now, because those same cases that weren't being reported before or weren't being treated, they're not going to go away. They're just going to get worse until they go in. And so our communication with the employer is that let's come in, let's clean up the problems that are already on the floor. And by this time, in our baseline measurements, we've probably already done a survey and asked the employees about their health and found out that 68% of the employees complain that they've got shoulder discomfort of at least 5 out of 6, or 5 out of 10, or 6 out of 10, right? So we know that they're already out there. So we communicate that to the company. They're there, right? Let's come in, let's get those taken care of. Let's fight through the short term, take care of them where they are right now, and then move to an opportunity to educate the employees and coming in and getting those things taken care of before they do become a workplace injury. So that they come in and we are more proactive and we are treating things that are a 1 or a 2 or a 3 or 4 on the scale out of 10, right? And they're not necessarily always directly related to their work. They're related to these 5 different things that we can't define as a workplace injury. And so we're going to take care of them at that point. And employees want to do that, right? They don't want to sit around and wait for a workplace injury. Most employees. There's a small fraction that want that.
Are we liable for getting a work comp claim started? Because I've had a few times where employers have sent me employees that was an obvious injury, didn't want to file work comp, just wanted to mistreat it for a week or so, see how it goes, you know.
Right, so the question is you know, the employee says, hey, just take care of them. I mean, I've had situations where the owner of the company called me up and said, don't even run it through the insurance, send me the bill directly, right? You know, that type of situation. Be very cautious about that. I would say that it's your responsibility to take good documentation as to the origin of the injury, the differential diagnosis, and your care, right? Those things, you're under no obligation to file with, you don't have to fill out the OSHA 300 log, you know, any of those things. So make sure your documentation is careful, but again, try to avoid that. That's an opportunity for some education on those things. I would tend to stay away from that situation.
That's just trouble, and it's not worth your time. So you got to think about it in a larger context. Say, well, okay, let's just say your best case scenario is you treat this guy 3, 4, or 5 times, something like that. It resolves, everybody's happy, it's not a recordable, you get paid cash. Okay, what'd you make, 300 bucks? Is it worth 300 bucks to take that risk of some kind of litigation down the road? What's it worth for your peace of mind? What's it worth for your integrity? So I think that it's a slippery slope, because once you do it once, then they want to come back again. They're going to do it again, and then they keep asking you to compromise your integrity. I just don't think that's a good idea.
One of the things that I think is really important to this discussion is that all of the other on-site healthcare providers out there, whether we're talking physical therapy or physician assistant or an MD or an occupational health, they are all still engaged in the reactionary system that treating work comp is involved in, right? I think that that's the great opportunity that we have, and one of the soapboxes that we try to stand on here, and we try to talk about this program, is not taking that traditional reactionary care, waiting until things get to be a 5 or a 6 or a 7, but really getting into companies, helping them understand what policy changes need to be made, so that we can encourage an environment where people are coming in and saying, you know what, for the last 2 days, I've been having some shoulder trouble. What can you do to help me out? Or, hell, I've had headaches on and off for the last 3 days. I've got migraines for the last month. Or, we need to change that health culture, and working with companies on that and communicating that message, I think, is really important, because as time moves forward, this whole idea of being on site, this is an idea that's being captured at a much faster pace by our medical counterparts, right? Much faster pace, right? So how are we going to differentiate ourselves? How are we going to isolate a market for ourselves? And I believe that it's exactly what Jim describes, is changing policies within the company and helping them understand that we want to drive utilization of really, really minor cases, or maybe it's even subclinical, right? That's the language that I'll oftentimes use with companies, is that we want to get in there. We want to improve the health and well-being of the employees wherever they are on that health continuum. Many of your employees are subclinical. Let's improve their health so that we've got a greater zone of care for ourselves. And that's I think where our value comes into play.
What I would say, to just pick up right where Chad is at, is to talk about being proactive versus reactive, proactive care, and then just talk about how you define that. And you can use the word subclinical. Sometimes they have no idea what that means or doesn't mean. They're not doctors. They would have no idea where these boundaries lines are drawn. You know, if something is clinical or not clinical, they don't have a reference for that. But they do understand reactive versus proactive. And I think that's really where you want to focus your energies on. And for better or for worse too, you know, another elephant in the room, maybe a smaller elephant, but one nevertheless, is that we're all chiropractors and we want to promote the profession. And that's not what you're there to do. You're there to help them solve their problem, their production problems, really. And we're going to do that through one of the things that we do is chiropractic care, spinal adjusting. But once again, that's one of 5 different things you're there to do. And the more you can help in these other things, the more value you bring to that. It's completely, this whole endeavor of then, if you were to write out a job description for the ideal job description of an on-site person with our skill set, right? And let's just assume that you go through this whole program and you get the ergonomics training and you understand some policy issues and management issues and all this other stuff, right? So you have this kind of a skill set and this resume over here. That looks entirely different than, let's say, you in private practice. It's a way different animal. When you're out in private practice, you can beat the chiropractic drum and say, hey, this is a great profession, this is a great service, these adjustments are, you can sing their praises, right? And this is what's going to get you better, this is how we're going to do it, et cetera, et cetera, et cetera. This is a way different deal. It's a way different deal. Matter of fact, they don't want to hear you beating that drum. Just like I was telling you earlier, it's not about you and it's not about chiropractic. It's about them. Totally and completely. Don't beat your own drum. Don't even beat the chiropractic drum. Say, this is what I think I can do for you. And these are the range of services and the skills that I have, and this is what I bring to the table. That's your value proposition. And you've got to do your homework ahead of time so that you know what you're talking about, and that you be humble about what you know and what you don't know, and have a nice, smooth personality. Don't be abrasive, and things will work out.
I just have a question about tracking your productivity. I'm imagining an on-site clinic and having to report a monthly report back to management. I saw so many people this month. I saw prevalence of shoulder complaints in Section A. I'm seeing a lot of sore hands coming out of this production area over here. What I did this month, and it's not a HIPAA thing. You're not giving out names, but you're maybe giving them some helpful information of your utilization, and that there's maybe some sensitive things
Yeah.
they might want to be aware of.
I do that. I've always done that. That's actually my mainstay metric is that right there. That's what I give the company. I give them the number of people I've seen. I give them the number of treatments I've rendered. New people, so it'd be like new patients, new conditions, aggregate number, and then I break it down per body area. So I break the spine into cervical, thoracic, lumbopelvic, those 3, and then upper extremity, lower extremity, and then within upper and lower extremity I break it into the actual joint area, shoulder, elbow, wrist and hand. Hip, knee, ankle, and foot. And so I give them that aggregate data, and then it's like how many patients I saw on any given day, average for a month. So I give them a monthly synopsis. On average, this is how many people I saw a day. This is on average how many treatments I rendered per new condition / new patient. So they kind of have an idea that I'm, how often are people coming? Because there'll always be that one guy or gal or whoever that's, God, is he still coming in? God, he comes in all the time. Yeah, but look at the average. This is the average case. And then you point out, actually what I would tell you this, and this is worth writing down, what you want to measure out there when you do your survey is the unserved, the underserved, the appropriately served, and the overserved. Unserved, underserved, appropriate served, and overserved. So when you do your survey, this is what's going to tell you what your demand is. Because there's a bunch of people out there that are walking around with problems that aren't doing anything. You're going to have people out there that are going to come in for 1 or 2 treatments and they need 3 or 4. Then you have the person that comes in and gets better. And then you have that person that keeps coming back. And when you address all 4 of these areas, you're being very real to the company. This right here is the most real thing that they want to understand, because you know what? There's a lot of mystery about chiropractors and what we do and how much benefit there actually is. But when you break it into these 4 categories, you take any ammunition that some naysayer has away from them. Because they say, well, what about this guy over here that comes in all the time? Well, let's measure that guy. What about these people that are never coming in? What about these people that come in once or twice but need to come in 3 or 4 times? Figure out a way how to capture this data. Because it takes away any kind of negative arguments and it builds positive arguments.
I'm confused a little bit in that I'm hearing you saying that we want the companies that you're agreeing to treat employees, but not other Wisconsin situations.
No, it depends on the program that's set up, right? So every company is a little bit different here. So you know, I think Jim's expressing that in one of his contracts, right, he isn't going to see workplace injuries after. He's non-workplace injuries. Other companies
I see them and I treat them, but I treat them with massage because that's the letter of the law. No, us chiropractors, we can, anybody, what you can do for a workplace injury, ice and heat and massage. Those are the 3 things.
According to what state in Minnesota?
No, national, is it OSHA, Joe? I think it's OSHA, to be a recordable. You can do those 3 things. If you do anything more than that.
Being a recordable, those are the only things you can do.
Right.
You can adjust them, you can go through your full treatment.
No, but then it's a recordable.
Then it becomes a recordable.
And that's what the company doesn't want. That's this thing that they hate, right? So a lot of times they'll come in and see me and it's a work-related. And sometimes it works out fine to our advantage. Like one of the companies, but actually both of the companies I work at, a lot of hand work, a lot of arm work. So they have a lot of elbow stuff that relates back down to the wrist. And you can do a lot of myofascial release in there. You don't call it myofascial release in your notes because that's medical care. You call it massage, which makes it some kind of something less. And you can get a lot accomplished with that.
And we're going to go through a couple of use cases.
Well, I don't know, trigger point. If you say trigger point, I don't know if that's. You could do it, but just call it massage. Yeah.
We'll get started again here, and we'll try to get through as much of the material as we can. One of the things that I want to clarify that came up again in between and after our discussion with Jim is kind of the idea of the workplace injury and what can we do and what can we not do. One of the things that I want to make sure that we're clear on is that when we're on site, we can treat workplace injuries and we can treat non-workplace injuries. And we can use our full scope of practice to do either of those. In the situation where we're trying to prevent it from becoming a recordable injuries, as soon as we initiate chiropractic care that's directly related to a condition that was work-related in its origin, that becomes a recordable incident, and the company is under obligation to record that and to put that into the work comp system. As we work through some of our case studies, I think it'll become a little bit more clear kind of how we handle that and the options that we have to be able to do that. As I said, with our programs, we're very upfront with companies in saying that most likely in the initiation of an on-site program, you're going to see an increase in the number or the incident of workplace injuries, and that will make companies very uncomfortable. But you need to, at that point, be able to share with them the idea that in the long term, we're going to drive that incident rate down through just improving the health and well-being of individual employees. The section that I want to move to, and then we'll get back to some case studies, is really on communication, because I think it's extremely important that we understand some communication aspects in regards to our health and wellness services, as well as our workplace injury services and our consulting services as well. When we talk about communication in regards to health and wellness services, we certainly want to know our audience. We want to be able to communicate, as Jim mentioned, the goals with management is how do we bring profitability to them? How do we improve productivity? How do we change the numbers that's going on? I would tell you that if we're going to communicate with employees along that level, that's not a message that the employees care about or understand or even want to hear about. And so when we're talking about wellness, then we want to make it individualized to that employee. And so making sure that we know our audience and who we're going to talk to. Certainly we want to know the laws within the state, and we want to stay within your comfort zone. Those are all things that we've talked about already. When we are communicating with the employee, we need to understand there's a couple things. You being an on-site provider, you've automatically initiated a doctor-patient relationship with all employees, whether you are treating those employees or not, when you are functioning as an on-site provider. Do we understand that? So even though they don't come in for treatment, maybe you're out on the floor and you're moving by, it's still a doctor-patient relationship that's in play. And the law tells us that we need to respect those conversations and all that comes along with that. And so understand that when you are on site at a company, whether it's your brother-in-law's company or your brother-in-law works at that company or your neighbor works at that company or however it might portray itself, there's always a doctor relationship taking place in that arena. In addition, employee communication, when we're talking about wellness items with employees, again, it's really important to talk in general tones unless we're in a treating environment, unless we're in the treatment room with our individual employee, right, and we're talking directly to them. If we're out on the floor and we're communicating wellness ideas or issues or this would be improvement, or really try to speak in general terms for us as far as that wellness information. Patient care information is no different than if you're in your clinical practice, right? When you're communicating patient care information in a treatment room, and again, we really highly recommend that if you're treating people on site, that you're doing so in a private setting that provides the appropriate privacy and respect for their health care information. Every company's different, and every company's facilities have different options. I've been in facilities where we were treating people out of a conference room, right? But the idea is that obviously you're the only one using that area, and really respect patients and the employee's privacy to that. Release of records, as far as communication goes, again, it works the exact same way as it does in your clinic system. You can't just provide records to supervisors or management or those types of things when it's in direct relationship to patient care. All of those records need to have the same respect as they would in your clinic setting. I will say this in regards to HIPAA and how you manage your records on site is also of extreme importance. If you have a treatment room that is, say, multifunctional, so on Tuesdays and Fridays it's your treatment room, right? But on all the other days, it's used as an employee workstation, right? Be very, very careful about who has access to those records. As a matter of fact, we really encourage, if that is the case, that we're not leaving records on site. HIPAA says that they have to be locked and confined. I wouldn't even leave them on site. In those situations, we would recommend that you transport those files back and forth between your office or at least having them off site. If you have a dedicated space that's your space, and you're the only one who has access to it, then certainly keeping files on site and those types of things oftentimes can be more convenient. But just understand that there is a respect for those files, those medical records, just as though they are in your clinical setting. When we're talking about employer communications and in regard specifically to HIPAA regulations, we need to make sure that the company understands that we are not at liberty, right? We're bound by regulation to protect the information that our patients give us. Oftentimes what will happen is that you'll have somebody that will come up and they'll try to interject a question about an employee. Hey, is Dale seeing you? Or how is Dale doing? Or can Dale get back to work? And it's extremely important that you understand that from a HIPAA standpoint, you really can't acknowledge that in any form. Now, we'll get into some case studies in a little bit how we can handle that in a way that's beneficial for everybody. If you have a release from the patient to talk to their supervisor, right, that's something we highly recommend and we try to do with a lot of patients, right? Jane comes in and we say, you know what, Jane, I really need to talk to your supervisor about this because I don't want to, you've had this back trouble for, all these years, and I don't want to put you in jeopardy. And I need you to do, stretches 5 times a day for us, right? Let me go talk with your supervisor so that your supervisor understands what's going on. Jane says, okay, right? We have her sign off on that process, right? Now we can go out and we can have a conversation with the supervisor saying, hey, Jane's got some back trouble. I'm going to ask her to do her stretches 5 times a day. Give me some feedback on whether she's really getting them in or not. What I've just done is that we put a check and balance system in there, so now the supervisor can positively reinforce our patient engagement and care, right? So that's something that's extremely valuable, because oftentimes patients go out there and then they're worried about, oh man, I'm going to have all this pressure to meet these productivity goals, and it's just reassuring when that supervisor walks up and says, Jane, Dr. Chad told me that I need to keep an eye and make sure that I'm giving you time to do your stretches. Well, that just diffuses a really potentially bad situation and reduces the level of stress, reduces the level of anxiety, creates a work environment that's conducive for improving Jane's health and well-being, right? And so that oftentimes, but only do that when you've had conversations with that patient and you've gotten the release to go out and to talk to supervisors. And I guarantee you, when you're on site, you're going to have coworkers come up, you're going to have management people come up, and they're going to ask about this person or that person. And again, if your answer is always the same, I can't discuss patient care. If there's a concern, I'll get back to you, is oftentimes what happens. And what happens, there's a lot of unwritten language oftentimes that came. I would have a management person come up and say, I really need to know what's going on with Julie because we're going to move her to a different department, and I need to know, is that going to be good or bad? Well, it's in Julie's best interest that I have that communication with that supervisor to make sure we're putting her in a good spot. But I just can't have that conversation without making sure that Julie's okay with me having that conversation, right? So then we can go back to Julie and say, hey, you know what? I want to talk to Paul, and he wants to move you into this area, and we want to make sure that it's going to work. Are you okay with me talking with Paul? Just get those okays, have that communication, and make sure that you're not engaging in conversations that you shouldn't be and violating the HIPAA regulations that are in place for a very good reason. One of the biggest ways to lose confidence and to have your on-site programs go south is to lose the trust of either the employees or management, right? And both of them will try to get you to, do the other, tell on the other person. And so just really play a neutral role in that. The other thing that I'm going to talk about as far as employer communication briefly here is the idea of reporting. Don mentioned the monthly reporting that's done, and oftentimes that is a statistical, as Jim mentioned in his programs. How many have I seen? What's the average number of visits per new case? How many shoulders or low backs or whatever body part we want to break it down into? I'm going to encourage you to have a more in-depth quarterly reporting and annual reporting, right? So if we're taking a look at, the biggest concerns that we found in the assessment are absenteeism, right? We should have a quarterly report on that absenteeism. If it's the incident rate as far as work comp, we should have a quarterly report on how many work comp cases have we seen in this quarter. And so that we can continually do this evaluation and forecasting to see if the services that we're providing are producing success. And we should never be afraid to have a bad quarterly report, right? The biggest trouble that I've ever run into in my on-site programs is when I wasn't completely honest, or I was trying to manipulate numbers on a quarterly basis. Companies understand that we can have a bad quarter, or that that might be an outlier. Be honest about those quarterly reporting so that our annual and our future reporting can get better, because we're honest about really what's happening and what's going on. So when on the bigger issues, like I said, turnover or absenteeism or morale or workplace injuries or some of these bigger items that we're tracking as far as outcomes are concerned, we really should be providing a quarterly report back to the company. Some companies, maybe it's a smaller company, maybe it gets read, maybe it doesn't. The next company that you walk into, they're going to want you in front of the board of directors each quarter to justify this. And again, that's where doing the assessment and setting the program up to meet the needs, as Jim would say, to bring value to your services, you need to meet their expectations in what might be done there. I want to talk a little bit about our communication amongst medical peers, because oftentimes what happens is that you're seeing patients that either might be seeing a chiropractor outside, or they're seeing their medical provider, and or you're working with them on a return to work type of issue. And again, I'll tell you that all HIPAA regulations apply. We need to have a release from the patient to be able to communicate these things with other providers. Oftentimes, what's taken place with our on-site programs is that we'll have a patient that in the past has seen another different provider, right? Maybe they saw the orthopedic specialist, and now they're back, and we're having a little flare-up again. Communicate with those medical providers on what care has been in the past. Don't just assume that everything is a new starting point. Really go back and take a look into that history. It allows you to develop relationships with the providers in the community that show that you really want the best care possible for that individual. And so really make sure that you're communicating, but you're getting releases of records to communicate with those other medical providers and show some professional respect, right? Maybe what's happened is that an employee had a workplace injury, or maybe it's even a non-workplace injury, and now they have some restrictions. And so now they're coming back to the company that you're on site at, and they have some restrictions in place. Well, a lot of times restrictions that are written in a treatment room at an off-site clinic really don't have a whole lot of connection with what the employee really does. I like to use the story about an employee that came in with a restriction that he couldn't weld. Well, welding at this manufacturing facility was pushing a button. But the healthcare provider, right, who wrote the restriction, found out that they weld. They were a welder. Well, he didn't want it, so he took him off of work. Well, it's really easy when you understand the job description and when you understand what the expectations, to call that medical provider up and say, and this is what HR people do, what are you doing? That's a terrible restriction. How can you be taking this person off of work? There's no way. Well, that's a pretty combative response, and unfortunately that happens, and maybe we've been on the other end of that in our clinical practices. Oftentimes I've found it to be extremely helpful to call up that medical provider and say, hey, this is Dr. Henriksen, and I'm on site at company ABC down here. I see that we have an employee in that's under restrictions who's seeking care through you. I just want to make sure that we're putting the employee back in a safe environment. This is really what their job description is, or this is what the expectations. Would it be okay if we had them do this, right? And they're oftentimes very accommodating as far as those restrictions are concerned, and really coming up with a restriction that's far more directed at what the condition should allow or should require for us. Third-party individuals. This is, again, something that is more unique in the on-site situation than it is in our clinical condition, right? Because oftentimes there are family members that work at the same facility, right? There are friends, there are co-workers. All of these people kind of work within this same environment. And when you start treating people on-site, what happens is that, it really is. It's kind of like this work family, and you get thrown into the middle of that work family. And even if people have direct concerns about this person or that person, we still have to respect that it's a doctor-patient relationship, and we have to be careful about the information that we're giving out to coworkers, or that we're giving out to friends, or certainly family members. Right? That oftentimes is a sticky situation as well. The other thing that I'll throw into this under third-party individuals are vendors. So we're going to be one of their vendors, right? We're their health and wellness vendor. We're their on-site vendor. But there's going to be maybe risk managers that come into play, right? There's going to be OSHA compliance vendors that come in and help them with their OSHA compliance. There's going to be insurance brokers that come through. And again, we have to respect the idea that when we're communicating with these people, we can talk about broad-scale things. We can't talk about individual employees. And sometimes we need to remind others of that, right? Vendors should know better, but oftentimes they'll say, so I heard that last week we had Sally over in shipping have this trouble, right? Or Debbie in accounting is having all these problems. Well, again, that's a conversation that you need to have a release to talk about, even if it's with another vendor. Maybe it's the risk manager, maybe it's their QRC, or any of these things, right? So we need to make sure that we have everybody aware of the communication channels, and we're not violating those issues. So let's talk a little bit about maybe a case study related to the data or the trends and company requests. So we have a company that we want to do business for. We're going through the assessment phase. In the assessment phase, we're taking a look at the information that the company's provided us. We're doing surveys of the employees, and we're collecting health records on the expenditures that the company's had. So they're incurring so many costs, whether it be work comp or non-work comp. What concerns should we have in the dissemination or the communication of that company data? So when we take a look at the loss run reports, we take a look at the expenditures, we take a look at the claims that have been made. What precautions do we need to have? Is this data public knowledge, right? Is it private knowledge? Is it company knowledge? Where are the limitations that would take place? And when we go back and take a look at the trends that have been in play there, who can we communicate these trends with? Oftentimes what my experience has been is that management is in control of a lot of this data, right? Anything that they provide us as a consultant needs to be kept within that consultant role. So anything we find out about a company, we shouldn't be talking about in our clinical office, right? Or we shouldn't go down the road to the other company and say, well, you guys are way better than they are, right? We need to be cautious about the data collection that we have and who release that to. One of the areas that gets a little bit sticky is, again, the trends that have taken place over time too. And again, it's really easy to sit in a meeting with another company and talk about the trends that you had at another place you worked at. And so be very cautious. Even if you're not giving out specific information, even talking about, well, I helped them do this, we have to be cautious about the communication and making sure that we have the release of that data from the company so that we don't release information that the company has requested to be private. When you're setting up your program, one of the really important things to do is to ensure that the outcome data that you collect and that you track becomes your rights, right? One of the big mistakes that I made in setting a company up wrong is that I didn't do that, right? And so when we did all the data, we did all the collection, we got all the outcomes, which were fabulous, right? I mean, we would love to be able to market those and share those with everybody that's out there. Unfortunately, what I didn't do is in the initial contract is I didn't write into that contract that I had full release of those records. Now, many companies aren't going to give you a complete full release, but what they will do is they will give you a protected release of outcome measures, meaning that they've got first right of refusal to put their name on the top of it. So if we collect the data and we reduce work comp cases by $200,000, in most contract situations that we're seeing right now, we want to make sure that we've got the right to go out and promote that information. One of the things that the companies often will do is that they want to know where it's going to be promoted, and they want to reserve the right to not have their particular name on it. And that's a really common situation now. So you end up being able to say at a manufacturing facility of 208 employees, these were the results that we got. You can't say that it was company XYZ. And that's a middle ground that I think that most companies are comfortable with, and allows you to be able to collect that data so that you can go down to the next company and that you can utilize that. And again, if you don't have that in play to begin with, it's gonna be a difficult process to get it later, because they come up with all kinds of reasons why you shouldn't have it. I've been told I can't have release of the data because it's a competitive advantage in the hiring market, that it's a competitive advantage in the business landscape, and sometimes they don't even give you a reason why you can't release it. And so have that into the contract so that when you go back to the company after the outcomes, you have the right to be able to utilize that information. Same thing with safety information, right? When you are in a meeting and you're bringing up the fact that, you know what, we have a safety issue in the accounting department, right? Maybe we have computer monitors that aren't at the right height, and we need to bring in adjustable screen monitors or something like that. Really be careful not to talk about individual people in those meetings. Talk, as I say here, the employees, not an employee, is really important for us. Don't specifically identify people. In a safety situation, there isn't a direct violation of HIPAA regulations. It's just good practice to get in the habit of always referring to generalizations and not individuals for us. So talk about the employees, not an employee, is something to really keep in mind there. So when we have a situation in regards to our recommendation, and this goes for things from that we talked about yesterday, like the BSI, or whether it's another screening process, or we have a recommendation for a ergonomic change, and or we have a recommendation for a healthcare communication. Understand that it's your recommendation to the company, and then that it's up to the company to decide from there whether they're going to initiate that. One of the mistakes that we see take place a lot is communicating to employees that, you know what, yeah, the company should have changed that screen height for us, right? Again, I think that it's a much better situation to say, you know what, we're going to recommend that the company changes that. And then you put the onus of the final decision on the company so that they can justify that. And maybe it's the fact that financially right now they can't put that lift in that we recommended. But when we talk to the employee and we say the company should do something, right? That puts the company in a liability aspect that they're not going to be very comfortable with. And so it's always our recommendation, or we think it would be best to, or we would like to move towards this. All of those types of, that type of language is extremely important when we're making recommendations back to management, and especially when we're communicating those changes to the employee. When we're talking out on the floor to the employees, I've done it myself. I've walked out and said, well, we can't have this. We got to change this, or this has got to be completely changed. Well, maybe because of production issues, or maybe the line is going to be changing 4 months from now, so they're going to wait to make those changes. Always be really cautious as to how you're describing things out on the floor with employees, because there's nothing worse than being called up to management's office and sitting down and saying, what in the world were you talking about on the floor? Everybody's all in an uproar out there because you said that it's unsafe and we can't change it until 2 weeks from now. And the company might want to change it, but it just has to. So be really cautious about how you communicate with employees when you're on site, as far as to the health and safety of the facility or the ergonomic situation. Really, really important. And the reverse goes as well, right? So when we're talking to the employer, when we're talking to the company, right, we can go out to the company and we can say, well, you know what, the workstation is about as good as we can get it. The problem is the employee, Jane doesn't even know what she's doing out there, right? Or her interaction with it is the problem. It's not the physical demand. Don't talk about individuals. Talk about how in that situation, it oftentimes is phrased as, Well, we've optimized the ergonomics of that workstation as much as possible, but unfortunately what we need to do is that we need to engage the employees in better utilization of that workstation. Don't throw blame on one individual person. Talk about it in a broader sense like that. Again, really important not to isolate individuals when we're having these communications, and especially in written form more so than anything. I'm going to skip that. So when we take a look at our safety communication for a workstation, a department, or a facility, right? Oftentimes we're called in to do some ergonomic work and to assess the safety of an individual station. But really that individual station depends upon the policies in that department and then obviously the policies in the facility. One of the things that I want to make sure that you understand is that if you're going out to do some ergonomic work, or maybe it's part of your care, right? So one of the things that happens with our on-site care is that we're treating somebody and we might follow them out to their workstation so that we can take a look at exactly what they're doing to make sure that their workstation isn't going to hinder their recovery and or cause more trouble. When we're taking a look at that workstation, I think it's really important that we not only look at that workstation, but that we take a step back and we look at that department in general, and from a facility standpoint, what are the policies that are in place as far as safety goes, and how can we improve the overall perception, even if it's only the workstation that we're looking at. The example that I'll use is this, is that I was asked to take a look at a workstation where they were doing some painting, and there's a ventilation system involved, and there was a number of complaints that that the ventilation wasn't adequate, and they were deciding whether they were going to go with masks and those types of things. The first thing I did is that I made the company aware that I'm not an air quality specialist, that I would be willing to go out and I would be willing to give my recommendation based upon my expertise, but that I wasn't going to go out there and I wasn't going to be measuring particles and I wasn't going to be measuring airflow through the ventilation system, right? Okay, so I set the expectations to what my expertise level was, and then when we went out there, one of the things that we found is that, yeah, you know what, we probably need to bring somebody in to check airflow through, you know, exactly what that quality is. But my expertise allowed me to be able to take a look not only at that individual workstation and the problem they were having there, but the idea is that because they had individuals who were better at spraying, right, and painting, they didn't rotate those people in and out of their job. Everybody else rotated except for the 3 people who were in that spray booth the whole day, right? Well, again, that's not just a workstation situation, right? That's a department situation that we come and play with. Right, so that workstation, we needed to change some of the policies of that department that was in place, and then we needed to take a step back even further and look at the facility and how they took a look at rotation, because not only was this situation taking place in the paint booths, but it was taking place at a number of other areas where people had become highly skilled at one specific thing, and so we changed some of those policies to be able to head off potential injuries. And so that's an example of staying within our expertise, taking a look at a situation, coming up with not only a solution to an individual workstation, but improving the entire department and really the facility in general. And I think that that's something that where we communicate, and when we build the trust level of the companies that we work with, that's where our value it becomes so very important, is that when we go into it, as Jim mentioned, when we go into it with the idea that we want to add value, that we want to try to create a situation where we can bring something bigger than what they expect, those are the things that keep us in contracts for long periods of time. And so we want to certainly encourage that as well. All right, so we are going to talk a little bit about some documentation stuff here now. We've made reference a lot to this OSHA 300 log. Who in the room has had an opportunity to examine an OSHA 300 log or take a look at it, or have you ever requested it from a company or those types of things? A handful of people, right? Well, I've made a copy, and I'm not sure that the copy came out ideal, but I think we can walk through and take a look at it. Tell me again, what does an OSHA 300 log do for us? I think I've got one here in the presentation. So what is an OSHA 300 log? Anybody? What is the main purpose of the OSHA 300 log? To track injuries, right? To track recordable injuries for us, right? And so the HR, in most companies it's HR, or management of some sort, is required to take this. And yesterday Joe explained to us who all is involved in the, who all is required to record this data. And when you see these come from the company, what you'll see is obviously column A is just the case number for the year, right? And the number of recordable injuries that they have here will be easy to define because they've got a numbered list right there. It's going to give the employee name. Most companies that you receive this log from have probably blacked out the employees' names. It's not necessary. This is a public document. These are workplace, these are recordable injuries. As a consultant, whether the name is blacked out or not blacked out isn't a HIPAA violation. Just so you're aware of that, because some companies will be a little concerned. But what the requirement is for the OSHA 300 log is to not only go through and to put down who had an injury at their place of work or who was involved in a workplace injury, but the date of the injury, right? Obviously the job title and the date are listed there for us. Where the event occurred, and then you need to describe the illness, injury, body part affected. So every company will have a different level of completing this survey, right? I mean, you'll have one company that it'll list the, John B., job title, production, date of injury, the date, where the event happened, manufacturing, describe the injury, hurt hand, right? So there'll be that level of reporting on this documentation. The other thing that'll take place is that you'll run into the next company, and that HR person has got it all laid out for you, right? I mean, it happened at 9:13 on Monday, January 18th, and it happened in aisle 8, right outside the restroom, and the body part is described and the injury is described. All of those things have a much higher level of description. So one of the things that I want to bring to you is that when we don't have very good description on this report right here, that should tell us something about the company's approach to workplace injuries. The company that has it all laid out here oftentimes is far more interested in further analyzing why these injuries take place. And all companies should be further interested in why these injuries and where these injuries take place. But it gives us not only the idea that we have an injury, but the level to which it's filled out says a lot about the company and their follow-up and all of those things. And as you'll see in your copy, obviously it has to be listed whether it's a death or days away from work or days with restriction. One of the things that I see that's changing a lot, and especially that's laid out on this report, is that companies used to go crazy over the number of days with restrictions, that an employee has restrictions. They never wanted to see that take place. They wanted to always drive that number down. And it's my contention that I think we should see a whole lot more of these cases where the restrictions are up and the days away from work are way down, right? So when we take a look at this report for a company, if you see that the number of days away from work are really high and the days with restriction are equal or lower than that, that tells you that we have a policy issue in place at the company that they don't want to get people back to work as quickly as they should, right? We want to try to, so that keys us off. We better have some more discussion with management on the return to work issues or those types of things, because we should see a higher number of days of restriction or job transfer than we do see days away from work. A really good indication of of again, a company's policy and or their perception of what's important. As Joe mentioned yesterday, the more we have people away from work, right, the harder it is to get them back, right, and the harder it is to restore them back to their previous health condition. And so anything that we can do to get them back in the facility, even if it's a complete job, you know, they're coming back to answer phones, or they're coming back to do some filing, or whatever the case is, we really do want to try to get them back in. Not only do we want to try to get them back in, but it's really important for us, especially if we have an opportunity to be on site and to connect with that employee, to help the employee understand why they're coming back, because most of the employees are like, I don't know, I don't want to do this filing, right? Well, you need to get out there and you need to communicate with that employee the value of being back and contributing, that we want to be around here, we're going to be able to manage this care a little bit better, and so having that communication so that we don't see those things take place. The OSHA log here, again, you'll see that on page 2 is really the summary where it talks about kind of the aggregate information. Again, this is a really nice form if it's been completed properly to be able to go through and to start giving our baseline measurements from, right? This should be part of our tracking measure. But we can't specifically rely on the accuracy of all of this, right? There should be a check and balance system in play with the person who does the recording as to, you know, how much energy and effort do we know that this is accurate, and do we see that the injuries that are filed on this report, do they really follow through when we're doing our survey of employees? One of the things that that I see take place all the time is that you'll see, you know, that under the OSHA log there's 6 shoulder conditions, right? In almost every situation, if you have multiple injuries to a certain body part, right, and especially if they're cumulative trauma, right, then undoubtedly you've got employees that are out on the production floor or are employees of that facility. Maybe it's even an office setting, and we're talking about risks, right? I mean, if we have 5 carpal tunnels, just about always we've got other people who haven't filed a report yet, but that are suffering from conditions that are similar to that. There's always been a parallel in that. So they're unreported at this time, but they're going to come down the pipeline if we don't get them taken care of. So I think that the OSHA 300 log is not only a great way to look at the history, but it also gives us some indication as to, you know, certainly where we need to go look and what we need to do. Taking this record, right, if we go through and we find that all the employees are from the same department, right, do we need to take a closer look at that department, right? If they're all the same condition, should we take a look at that? How about if we're only getting reports from all of the people who are over 40? Or maybe we're getting reports, the majority of reports are from people who are under 25, right? Or maybe when we look at the dates, you know, one of the things that we do when we look at the dates is that we don't always just look at the specific day, the day and month, but was that a Monday, or was that a Tuesday, or was that a Wednesday, or was that a Thursday, or was that a Friday? And we always break that down when we're doing our analysis to see if we have a higher prevalence of Monday injuries, right? What would Monday injuries indicate for us? Anybody? Presenteeism, what? Weekend warrior type stuff? Yeah, right? And we got people coming in, and if you're setting your on-site program, right, and you're looking at the days in which you're going to be on site, and you find out that more injuries are taking place on Monday than any day of the week, you want to make sure that you're there on Monday to clean up that stuff that's happened from the weekend. And or sometimes the opposite is taking place, right? What's happening is that all of our injuries are happening late in the week, right? Thursday and Friday is when, because what's happening is that they're on overtime and they're working, you know, they're working 5/10s or 5/12s or whatever the case is, and so all of those conditions are taking place at the end of the week when they're starting to burn out. Well, you better have an opportunity to be on site towards the end of the week then, right? That's how we validate with the employer how many hours we're going to be there and which days we're going to be there. And so this is one of those indications when we take a little bit closer look as to how we can plan out our schedule or what's going to be important for us. in addition, it allows us to come back into the future and say, hey, this is how we've affected these things. Sometimes what happens is that we look at these reports after we've been on site for a year or two, and then in that situation, are people reporting injuries on the days that we're there, or are they reporting injuries on the days that we're not there, or how is our program affecting the reportability of injuries? And maybe we need to alter our program just a little bit, or maybe what we need to do is we need to make the offer to not only have increased on-site time, but we need to have availability when we're off-site. So in our programs, one of the things that we do is that we'll guarantee a certain number of on-site hours. But we will also talk to the company that we will provide contact information so that within a 4-hour time period, we're going to be in communication with anybody that gives us a call, right? So it might be your local clinic, right, in which they can call up your local clinic and say, hey, we have Sally here who's having some trouble. She really needs to get in, or should we send her to the ER? Should we do this? You know, we get those contacts all the time. And so maybe that's a bigger part of our program. Maybe we need to be more responsive to handling those conditions when we're not there, so that we can make sure to drive down these numbers here for us too. And again, this last sheet is really more about the logistics of the form. All companies are required to submit these into OSHA, right? So they keep them on file, and as Joe mentioned yesterday, one of the top violation that OSHA finds is record keeping. And it's most of the time because these documentation, this hasn't been documented well enough, and or it's incomplete. I will say this, is that when we have a workplace injury, the employee is required to make a report to the company. And if the employee doesn't report the workplace injury, and 3 months later they come back and they say, hey, you know what, I've had this carpal tunnel thing, and but it really started back in October, but now I can't deal with it anymore, with these cumulative trauma conditions. It's really difficult sometimes for companies to decipher what's the date of injury or onset. And a lot of companies have moved towards a system where if the employee doesn't report it within a timely manner, that their insurance company or the company in general will fight that, and or the employee will be under some repercussions because of it. There'll be oftentimes a verbal or written warning, or will go in their company file as a doc against them. And so it's my experience that most companies in today's marketplace are doing an average job of filling this out. So, there's been enough press, there's been enough work in the HR community, there's been enough awareness within the corporate world to understand that this is a cost of doing business, and we have to do this. When I first started, I had companies that weren't keeping these records at all. But that's pretty rare in today's world. And so this is, again, becoming a better and better source for gathering some initial baseline data and tracking the outcomes as far as a work comp situation is concerned.
So when they talked before about not doing manipulation treatment, that has to be recorded in there by the board.
Right. So we'll talk just a little bit about that here now too. In our discussion with Jim about not manipulating and writing down massage as opposed to trigger point therapy or those types of things, what that topic is around is recordability, right? That's putting the name down on here. So if as an on-site provider somebody comes into my treatment room and says, Dr. Chad, you know what, I was at my desk and I bent over to pick up a pen, and now my back is in horrible shape, right? I can't even stand up. Is that a workplace injury or is that not a workplace injury? That's a workplace injury, right? If I initiate treatment on it, then it becomes a recordable injury, right? So then we have to record what's going on in that situation. If I apply first aid, somebody comes in, says, Dr. Chad, I burnt myself. Should I go in to the emergency room, or what should I do? And I say, you know what? It's a first-degree burn. It's not a big deal. Let's get some ice on it, and we'll bandage it up, Now that's a first aid issue. That doesn't have to go on this, right? There's a difference in recordable and a reportable is what's taking place. And what Jim was discussing as far as our language or our verbiage is turning something from into a recordable injury that now, because what happens is that for every recordable injury, right, the company has to set aside financial resources to be able to manage that case. So there's a reserve that gets set up where the company's got to set aside whether they're going to use it or not, right? And each condition and each diagnosis has a set amount of money that the company has to set aside. So that's part of the concern that the company has, is that the more recordables they have, the more money they've got to pull out and they've got to put into this fund that they can't use or touch, right? And so that's a really big concern that companies have, is having all this money over here and until that condition is completely resolved. Once that condition has been released from care and completely resolved, returned to normal, or a disability has been set, that money stays off there, and they keep drawing from that. And many companies, one of the companies that I worked with, they weren't even managing that resource, and so they had work comp cases that were on these from 4 and 5 and 6 years ago, where the employee was completely resolved, but they never took the time to take that money out of reserve. And so one of the things that I looked really good at is that we moved about $500,000 out of their reserve strictly by finishing up the paperwork, going out to the employee and saying, hey, Dale, have you had any treatment on your shoulder? How is it doing? Is it back to normal? Yep, signed off on it. That money can come out of the work comp reserve back into the company's bank account, and we took $500,000 and transferred it out of that fund just because nobody ever went out and asked them if things were taken care of. Everybody was happy, but the company still had $500,000 that they didn't need in that fund, and those are $500,000 worth of resources that companies tend to enjoy having. And so going through and making sure that the names that are on the list, that there's some sort of status on these claims, is another service that you can provide, right? So we can take a look at the names on the list here and say, go through and where are we at? What document would we look at to see if there are claims that are still outstanding from an injury report? Does anybody know? There's a document called a lost run report. Okay, so the lost run report will tell us a couple things. It will tell us how much money was initially set aside. So we're talking a work comp loss run report right now. We'll talk about general medical in just a minute. But a loss run report will show us how much money was set aside for the care of that particular injury, how much of the money that was set aside has been utilized for medical care, how much of that money has been set aside for indemnity care and administration care, right? So, and then what the reserve is at the end of that. And it'll also tell us, the lost run report will also tell us whether that case has been closed out or not. And it's a document that you have to ask for from the third-party administrator, or the insurance company will send you the work comp loss run report, and it'll give you all of these conditions. And what we do is that we ask for the loss run report for the last 3 years, so that we can go back 3 years to see exactly what their costs were in the work comps area, how many of those cases are still open or they're lingering, right? If we have a high number of cases that are still open, right, and still haven't been closed out, that's a very dangerous thing, because every little flare-up that employee has the ability to go back through that case, right? So what we want to do is that we want to return the worker to their healthy status, get them back to work, and get them off the work comp books, right? From a company standpoint, financially, that's a really big gain for them. I believe for the employee, it's a really big gain as well, because something happens in the psychology of a workplace injury. And when I first heard this statistic, I just couldn't believe it. I didn't understand it. That the same diagnosis for a workplace injury will take 3 to 4 times as much cost as a non-workplace injury of the same diagnosis, right? It's the same condition. How can it possibly cost that much more, right? Well, there's obviously boatload of administration fees involved in that. There's oftentimes there's some legal issues that are involved in that. More often than not, what's happened is that the employee has been taken off of work for a longer period, which elevates the cost. Than if I just if I broke my if I fell out of the tree on my own and can't, I'm going to try to get to work as many days as I can because I don't want to use I don't want to use my vacation. The idea is that I really strongly believe that we need to engage the employee back in the work environment for their own sake as well. I think Joe used the statistic that if you've been out of work for 2 years, there's 2% of those people that will engage back in the employment process. Does that scare anybody? I mean, 2%. What do those people do? We wonder why our financial system is in such turmoil, right? Why work comp is such a big thing. But those people are when we can't get those people back to work, it's an extremely difficult situation. So make sure that we're looking for the OSHA documents here, and certainly the loss run report. Now I'll say that the loss run report we can also consider on the general medical side of things too. So a loss run report on general medical, they can break that down in so many different formats now. It's wonderful. 15 years ago we got the total expense for the year, and that was all we got. But now we can have that loss run report broken down into conditions, right? So we can say how many cardiovascular related, how did cardiovascular conditions turn out on the financial bottom line of the company? How about orthopedic conditions? How about shoulder conditions? From a general healthcare side of things, these are all numbers that are very, very easily attainable by the company if we can get the employer to request it from the insurance company. If I call up and I say, hey, you know what, I'm a consultant for company ABC, can you run these reports for me? It's going to take forever and I might not ever get them because I don't pay that company. But when I have the employer call up who is paying that company, they get a lot better results. We follow that line of thought there for us. And so asking for those loss run reports in the beginning, again, much easier to manage and your outcomes and your data that will affect the overall program for us as well. Yeah.
The work comp loss run reports the company has those, right? Medical loss runs are at
the insurance company, most of the time, you'll have to go through the third-party insurer to get both of those reports. Again, remember, it will depend upon whether the company is fully insured or self-insured. And unless they're an extremely large corporation, they're probably having, even if they're self-insured, they're most likely having a third-party administrator handle all of the claims management. So it's the claims management people that you need to. If you go in and you talk to the HR people or you talk to management and you say, hey, I want to have this loss run report, they're going to know exactly where to go to get it because that's something that an insurance industry provides them for business decisions and those things. Gary? Sure. So in the situation that Jim was describing, he has a contract with the company where they don't want him treating work comp cases, right? Right. So in his contract, that's part of it, right? They may come into you and say, you can come in and you can take care of all of our wellness visits, but we're not going to treat anything on site that's work comp. And that's that's the case that Jim was describing. And in an effort to try to prevent people from getting into that work comp system is where he was communicating upon, doing his massage or those types of element. Every company is going to be different as far as the services that they want you to perform or don't want you to perform. It is our contention that we want to be able to communicate with employers the value of treating both work comp and non-work comp, but really having our care focused on that non-work comp so that we can improve the health and well-being of as many employees so that we don't see that workplace injury. I don't know the exact statistic, but I'll just say from my experience, 15% of workplace injuries are due to accidental situations. Something broke, right? I ran my hand into the saw. I think that 80% or more are related to people just not being in very good health and then something taking place. What we want to do is that, and the message that I believe we should be giving employers is, let's take that 80% of those injuries and let's just have them be healthier people, right? And we're not going to do anything about the guy who runs his hand into the saw because he's distracted. There's obviously some administrative things that we can do in regard to that, but really improving the health and well-being and putting policies in place that make it easier for people to become healthier, I think is extremely important in improving that system. And not only just for the work comp system, right? We're going to get in the door of many companies because of the work comp system. But I think that we need to expand that discussion to making some improvements on the overall general health care dollars that are being spent out there too. And if we have healthier people, like Jim says, they're going to be more productive people. You want to add value to a company, add productivity to their workforce. Well, the only way that you can add productivity to your workforce, right, the services that we offer that do that, is to improve the health and well-being of those individuals, right? And reducing the risk of injury, reducing the risk of illness that are in place. And I think that we're in a very good position to be able to do that. I'm going to give us one last break, and then we'll come back for that last hour. And if you have questions, I'll be happy to stay at the end too. But we'll take one quick break here, get started at just after the hour. All right, we've got a short amount of time to finish up with what I'm just going to kind of go through the last part of the slides and just hit on some things that I think are, again, directly important to what you're going on. We've talked about some of the loss run reports and the OSHA 300 log. One thing I want to point out to you, and again, here's the link, and we're not going to go through the full case study here like we had planned, but profits that are lost are a big part of what we're trying to bring value to a company. And there's ways to be able to calculate what those losses are and obviously use that as a baseline, and then in the future go through and find out the difference in that. And there are a number of different calculators that are out there. This is the link to the profit loss calculator that, again, I think is an extremely valuable tool when we're setting outcomes and measuring things. There's a number of different ones out there. This is one that I think is really good. And again, it's put out by OSHA, which brings, again, more validity. Some of the other calculators are put out by individual companies, and sometimes I wonder whether they're marketing tools or real outcome measures. But this is a real outcome measure here, and again, I just want to point that out to you. The idea is that if a company is whatever they do, right, whether they're a service industry and their profit margin is, let's say, 8%, which is really good, and they have $100,000 in workplace injuries, right? How many more dollars of services do they have to provide to make up for that loss? And or in the general health care, if we can reduce general health care dollars by a significant amount, from a business standpoint, how does that translate into sales for them? And this is a tool that I think is really, really valuable in talking with companies, because again, when we're looking at adding value, it isn't always about the number of injuries we can reduce or those types of things, but using these business calculators that companies are familiar with can be of a great time-saving measure, right? For us to go through and to try to calculate these things are very difficult. I will also extend the invitation for further communication. I've had the opportunity to spend a fair bit of time in communication with David Chenoweth, who is a researcher out of North Carolina who measures the outcomes of health and wellness programs. He's probably he is the leading researcher in regards to health and wellness programs. If you take a look at any peer-reviewed journal where they're discussing healthcare programs, there's a good possibility that David Chenoweth has been involved in that. And he has given me great insight and great opportunity to share with the profession. Not that we can do that in this series, but I'd be happy to point you in a direction for measuring some of these outcomes that are so very valuable for us, and utilizing the tools that these researchers have put into place so that we don't have to spend hours at our kitchen table at 10:30 at night putting together surveys for it. So just know that's available there for us too. I want to talk just again briefly about again some more communication issues. From an electronic data collection, again, we need to be extremely cautious about the information that we're bringing in and or the information that we're providing to the company. And it doesn't matter if it's in paper form or electronic form, obviously. The other thing that I want to bring your awareness to is the idea of intellectual property. So you've seen in my last presentation the number of the pictures that we walked through and video of being on site. Be really, really cautious in your collection of all of that data, that the company is comfortable with whatever you're doing. Don't ever take a camera on site to a facility. Don't ever video anything without an expression of release from the company. And I would highly encourage all of you, as you engage companies in discussion and coming in to do, say, the assessment phase, that you offer to sign a release on the privacy issue of their intellectual property. How companies go about their business is extremely valuable to them, and in our world today, other companies would pay big dollars for some of that intellectual property, and so they need to be very cautious about that. But it just provides an opportunity for you to become a professional in communicating with these employers and knowing that there's an appreciation for their intellectual property. And by that I mean just how they make their, how they go about their business and the information that they gather, whether they're a service industry or a manufacturing facility or whatever it is. Oftentimes, they want some privacy, and don't be afraid to sign that. And we certainly want to respect the company's information just as though we would respect our patient's information. I do want to recap the idea that much of what we talk about is in the manufacturing side of things, but I want to open the door in the discussion a bit beyond that. I would tell you that I think that your best marketplace, right, what we consider at the Sweary Center to be our target market, the area that of employers that we feel is best suited for our services, is that small to medium-sized company, right? Anywhere from really 50 or 75 up to 1,000 employees, right? We believe that there are three industries that are our target market, and that is the transportation and warehousing, that is healthcare, and the third one is manufacturing, okay? So we believe that those are our best targets. When we try to put together our business plans and we're trying to isolate quality leads and follow through, that's our primary focus. That being said, we're certainly not going to turn away others who are outside of that, right? We don't. We believe that this model or this philosophy really can work at everything, as I've mentioned, from a dental office of 12 people, right down to the largest of our companies in the United States and beyond. So we believe that this market. But when we're out there searching, I just want you to know that there's a target market, and whether they are a manufacturing facility or whether they're a facility that has, say, more office-related jobs, or whether they are a service industry, again, it all gets down to the same ideas, is that we're trying to create a safe work environment, and we're trying to improve the health and well-being of the employees. Now, which company doesn't that work for, right? That's a pretty big mission. So just know that again, a lot of what we talk about is manufacturing, and a lot of what we kind of go through seems to be related to that. But boy, our services, what's always interesting to me is that the companies that I've been on site at, is that we see better improvement in the health and well-being of the people who have the office jobs and work in the front of the facility as we do the people who are out on the production floor, right? It's always amazing to me that when we really get in there and we really analyze what's going on, those people who are in a sedentary work situation oftentimes need more attention to improve their health and well-being than the people in the production. The people in the production area, they might come along with a higher level of risk, right? There's a higher level of risk of injury that's in there. But from improving the health and well-being, right? And when we're talking about wellness, that sedentary worker needs our attention, and certainly is going to need it more so moving into the future for sure. So we have all of these, all of this data that we're going to be able to collect. And again, one of the things that we want to make sure that you understand is that this isn't data that the company is providing you to go out and utilize it in different formats. And so really respect the documentation that they provide you, and keep making sure that you're respecting that privacy. One of the things that I'll say about the documentation as far as interviews, questionnaires, and surveys, I think we covered this before, but it's worth saying again. I think it's extremely important that all of those surveys, all of those questionnaires don't have a name attached to them. Don't, when we go out and we're trying to get feedback from the employees, leave the names out of it. Have a situation where they're contributing their information without any thought of having some repercussions to what their answers might be. And so we really encourage you. One of the companies that I've done some survey work for had been doing a lot of their own internal surveys, but they were requiring employees to put their name and their employee number on there, and you would be amazed at the dramatic change in the results of that survey when we simply took the name off of what was going on. And what it allowed us to do is it allowed us to get a really true understanding of where the employees thought things were. And where employees think things are is related to health, safety, wellness. That's where they really are, right? Because that's their mindset. And so oftentimes what happens is that management idea of where things are is dramatically different than where the employee's perception of that is. And so I would highly encourage you to take names off of surveys and questionnaires and those types of things. And even when we're doing interviews, so one of the things that we do in the assessment phase is that we go out and we say, hey, I'm going to look through your facility, and while I'm looking through your facility, I'm going to pull aside a handful of your employees to ask them a few questions. Are you okay with that? And we get that permission. And that's a process that we go through amongst that facility evaluation. The mistake I made when I first started this is I would go in and I'd say, I want to do these interviews with these employees. And I'd say, so get 5 employees that I can go and interview. Well, 2 things happened, right? The HR person picked the 5 employees that she really wanted, right, to give input, right? And those 5 employees knew that management knew they were going to be interviewed. And so you get such better information when you're observing somebody on the floor and it's just you, right? Don't, highly encourage the HR person to keep their distance, or the management person not to be looking over your shoulder as you're doing a facility evaluation. Really try to encourage them to give you the time to go out there and to just spend time amongst the employees, because one of the things that you'll find is you'll get a lot more honest feedback in that situation. They'll always be uncomfortable to begin with, right? Here I come, and I've just gotten out of my management meeting, and so the only thing I've done is taken off my jacket and my tie and rolled up my white shirt, right? And they look at me like, what are you doing out here, right? And now I've got a camera and I'm starting to take pictures, right? Now they get really nervous, and so we always engage them in conversation. And as Jim mentioned, one of the things that we need to do is understand that these are people, right? Whether they're management or production or whoever it is, they're people just like all of us. And so engaging in a conversation really brings down those defenses. And oftentimes when I'm out there and doing a facility evaluation and taking a look at things and I'm interviewing employees, I try to do one thing. I try to find out who in that department is the extrovert, right? Because they're the ones who are smiling for the camera pictures and come on over here and take a picture of me and that type of thing. And then I try to find out who's on the opposite end of that spectrum, right? And what I try to do is not interview either of those people, right? Try to interview somebody in the middle of those 2 people, because again, I get better feedback. And oftentimes it isn't walking up to them and saying, hey, do you feel like this is a safe job? If you want to engage employees in conversation and you want to get really good feedback, just go up and ask them about their job. What are you doing here? This is amazing. I can't believe that, at this end of the company, it starts off as as a trailer. And by that time out there, there's a whole house going out the door. This is crazy. What part do you have in that, right? And they'll start to tell you, and they'll start to get engaged, and then you can introduce the idea of, what would you do to improve safety here, or what do you think can be done to improve the health and well-being of employees? When you get people engaged in that type of conversation, you're going to get a lot better feedback, and you're going to get honest feedback. And oftentimes, what's going to happen is that by the time you've moved through departments, the word has already spread, right? The word has already spread, and by the time you get to those last departments, you got people coming up from all over the place to give you all kinds of information, right? Should happen and that should happen, and take the time, listen to them, understand, and always relay to them that you're here to do as much as you can. That we're going to see if we can't move things forward, and really have that that type of philosophy that you want to gather all of that information. 80% of it might be useless, right? But if the employee thinks that the information that they're giving is useless, then they're going to be quiet, and then we've lost them. And so continue to gather that information and then make your assessment at that point. And really, really an important thing to go back in and convey that to management, right? Say, well, I know that this is what you think, but this is what I'm finding out there. And don't ever say, Rob tells me that his supervisor is the biggest SOB, right? Right? We have some discrepancy between production and mid-level management. That type of conversation is how it should be to management. And because you don't know, you're seeing one little snapshot of what's going on in there too. So when we talk about middle management, and again, I'll just be brief with this here. I want to give you time for your test. Middle management, I'm talking supervisors, line leads, maybe it's department heads, they're the head of accounting. We have to be really cautious because oftentimes these are people who have been that production level employee, right? And now they've elevated themselves to middle management, so they're kind of in between the decision makers and the worker bees. And so they're oftentimes, they really want to be of assistance to those workers, right? They really want to engage them, and to the point where they're going to come up and they're going to say, hey, you know what, did you see Dale today? He's in my department. He's been complaining forever. Can you get him in your office? What do we need to do there, right? We need to be cautious about how we communicate that message and or reporting back to them after it's all said and done. These middle management people, I think, are really, really key in driving the utilization of your program. These are the people who are responsible for production, right? These are the people who need to see some outcome, and so we need these people on our side to facilitate the program as far as a utilization aspect. With our on-site companies, we have a special meeting once a month with all of these middle managers, right? We bring them all together from all the different departments, and we communicate with them on where we are going with our program in general. Is there any issues that they have? How can we be of help to them, and how can they help us? They thrive on that. These are people who understand the jobs that everybody is doing, and they have some decision making in how that takes place. And so really utilize these people in your programs and managing that. Senior management people, again, we need to understand that what the goal is in communicating with senior management people, and that is to change the policies that are in place regarding health and wellness and to change the culture that takes place. But we can only do that if we're meeting their goals, right? These goals that we want to achieve shouldn't be our goals. They've got to be management's goals. We've got to have an understanding that we're meeting their goals and the perception that we bring value to the company, right? That's where we want senior management to look at us. We want senior management to in their meetings when we're not there be going through and saying, well, you know what, how can Dr. Chad help us with this? That should, when we get to that point, that's a very, very valuable situation. We've talked about scope of practice and the doctor-patient relationship. Again, if we take a look at the definition of a workplace injury, right, here it is. A workplace injury is an injury or illness that occurs in relation to an employee's job. Most states narrow the definition of a workplace injury to one that arises out of and in the course of employment. So, it's my belief that we shouldn't try to hide work comp cases. We should just call it for what it is and treat them and take care of them and move forward in that light. Most states hold true to that the injury must arise out of and happen in course of employment. Again, work comp is a changing landscape. There was just a case that was brought to our attention within the last year where an individual was walking in an office environment, ended up tripping, falling, and hurting herself, right? And in past, it would have been my definition that should have been called a workplace injury. Well, because of arises out of and in the course of employment clause, it was determined by the Minnesota Supreme Court that this wasn't a workplace injury because the individual who fell was wearing high heels. And high heels were not a requirement of her job or an expectation of her job. And while she was walking, although it happened at work and during her time, she was making a trip to the restroom. So it was determined that it wasn't in the course of employment, right? And it didn't arise out of the work that she was doing. And so in that situation, that condition it was ruled to be a non-workplace injury. And since that ruling from the Minnesota Supreme Court, insurance companies are going to use that to the hilt to deny work comp claims, right? And so we just need to be aware of situations like that. How about the situation where an employee pulls up tomorrow morning in the parking lot and gets out of their car, and as they're walking up to work, slips, falls, and hits their head? Is that a workplace injury? It used to be, right? Right. Let's say it's on ice, right? Let's say it's icy. Well, that used to be. That the case I just described now calls that into question a little bit. I'm going to say that still most work comp judges will find that is a work comp injury. Number one, maybe they weren't at work yet, but it's an expectation that they arrive at work and they're on company property and they're going to their job. But boy, I don't know. You know, the landscape is changing, and so I think this definition of what a workplace injury is, we need to pay attention to. And so I would encourage you to continue to do that. I would encourage you to stay in communication with the organizations that we described just a little bit ago. As these types of cases come forward, those are our sources to be able to learn this information. So really pay attention to those things. Another thing that another case that I wanted to bring up is one that I get a lot with companies, and it talks about liability and what is a workplace injury and what is a malpractice issue. So let's say an employee gets up from their workstation and is coming over to treat you, and on their way to treat you, they slip on the wet floor. Whose liability is that? Is that you as an on-site provider? Is it the company's liability? Is it a workplace injury? Anybody have any thoughts? Yep. The employee got up from their workstation. On the way over, they slipped. There was water on the floor, and they slipped and fell. Yep, it's work comp situation there, right? Because it didn't provide a safe work environment. So that's that's pretty undistinguishable. What happened if that employee didn't slip, but as they were entering your office, they closed the door and pinched their finger and ended up having to have stitches on their finger? Whose liability is that? Joe says work comp. Anybody else? This situation is disputable, right? Because it wasn't directly related to their care, right? Had nothing to do with that, but they were entering our treatment room and in our facility and in our space. I'm saying that in that situation, you better make sure that you've got that umbrella policy that we talked about, that you've got some business liability insurance. It's not a malpractice condition. Your malpractice employer isn't. But I'll guarantee you that in that situation, most likely if that employee turns to an attorney, it's going to be both your case and the company's case, right? So making sure that as you're entering into these arrangements and it's pretty well defined. It's been pretty well explained to me that once the individual employee enters into your treatment space, they're under your liability at that point, right? And so be cautious of that. Joe?
I think a lot of companies also provide an on-site fitness facility. And I think you guys know there's really high potential strain or overexertion. And of course, it's a benefit for you forced to do it. But my goodness, I would say a third of the students that I treated here when I was in the clinic system was done in the fitness room. That's how they hurt themselves. And so that would be another gray area, I think,
Right.
not in life and it doesn't survive, but again, it's like part of the environment.
Again, these are questions. I don't mean to bring them up to put fear in us or those types of things, but these are all things that we shouldn't take lightly as we branch out and look to a different avenue through which we're going to provide services. And so certainly be aware of them. I do want to give you some time to finish up your testing and respect your ability to get on the road at the right time. So I'm just going to finish up with the fact that the Sweary Center, it's been our goal to try to provide some sort of foundation for you in this 36-hour program to give you a little bit of insight on working with employers and going on site and providing some chiropractic care in addition to some additional services that are out there. We fully understand that 36 hours doesn't give you all of the answers that you want. And oftentimes, and secretly, it's been my hope that these 36 hours elevate the number of questions that you have and elevate your interest as you continue to pursue and go out and potentially work with employers. Please know that the Sweary Center, it's our mission to help DCs be successful within the work environment. Our primary goal is to be able to collect some research so that we can prove the services that we provide as chiropractors make an impact in the health and well-being of individuals. In that light, we have Brad's biomechanical lab up and going. We've got research projects that are in the works. Certainly we're trying to do a number of things from the ergonomic division and this whole idea of on-site. I want to make you aware of the opportunity that's out there. That one of the things that at the Sweary Center we feel is a really exciting opportunity is the ability to work with DCs who are out there in practice, who have relationships with companies. If you have companies in your community where you have some sort of relationship or you would like some sort of relationship and you want to be able to provide services, please don't hesitate to be in touch with us. We have avenues through which we can provide assistance. We are currently working with DCs right now in a number of cases where they're going to be the on-site providers. We're going to manage the programs, and so they don't have to worry about the research. They don't have to worry about the managing of the programs, the marketing of the programs, or those types of things. And so if that option is attractive to you, we'd be happy to fall into some discussion about how we can assist and improve the relationship with local employers for yourself. And again, if there's any additional questions, right, we didn't even get through all of the material, but if there's any additional questions that you have as you go out, whether that be on Monday or whether that be a month from now or 2 months from now or whatever the case is, don't hesitate to be in touch with either Joe, myself, Elizabeth Oppel. We're here to be able to answer those questions. And as I said, I think that there should be a lot of questions that arise from good education. I think that's kind of one of the more valuable things that we can do is as we learn something more about a topic, we learn that we don't know what we don't know type of thing. So don't be afraid to bring those questions or those concerns forward. We'd love to be able to help you succeed in whatever endeavors you have with the employers that are out there. So